Thank you, everybody, for coming here, for all the interest for this seminar that is very relevant in the timing. And we even changed the title in order to stress that we need to move from negotiation to action and strengthening the governance of and the building financing for pandemic preparedness and response. So we know that pandemics will come, and it's not a matter of if, but when. So we're very happy to have our Deputy Minister of Health, Javier Padilla, who has come specifically for this seminar in order to open the discussion. And we want to allow time for questions. And thank you so much. We will be in touch in order to create this community of health, from the governance, the architecture. We want to have a comprehensive framework, and also for the needed financing. There are a lot of diseases, but there is only one health. Please, Deputy Minister Javier Padilla, the floor is yours for the opening remarks. And yeah.
Thank you very much, Eva, and thank you especially to the Spanish Embassy for the invitation. It's a great pleasure. Thank you very much also to IS Global and the Center for Global Development for organizing this meeting. I think that talking about pandemics and prevention, preparation, and response nowadays is even more accurate than some years ago. Now it's the time to get ready for the next pandemics, but not only pandemics, but also for every public health emergency that we are facing globally. I think that we should be conscious that the increasing capability of human societies to invade natural ecosystems is making us even more vulnerable to some different risks, especially zoonosis, infections coming from the animal environment, and also more vulnerable to many other risks. I am talking especially to systemic risk affecting health, and I think that there should be three main risks that we should be taking in account when talking about that. I am talking about pandemics, but I'm also talking about climate change, and also about antimicrobial resistance. I think that these are the main three global topics when talking about public health, and all of them are also related to the main challenge we are facing as society, especially when talking about health, that is social inequality. I think that we should be very conscious that preventing pandemics talks us about how we are shaping our society, our model of society. The best preparation in order to face next pandemics is strengthening our health systems. We should not move towards a model of preparation that is focused only on acting over surveillance or other specific and vertical programs talking about preparation for pandemics. I think that we should be talking about how to get health systems even stronger in order to make societies healthier, and also in order to be more capable to face next pandemics. I think that something that we are going to talk here today is about the governance of this prevention, preparation, and response for pandemics. And I think that when we are talking from the global north, we should be quite humble, because I think that in last decades we have been like externalizing our prevention action, talking about pandemics. We have been saying that pandemics should be prevented in these other countries that are not ours. I'm talking about Southern Asia or Africa or even Latin America. And we should be very conscious that if we are talking about global health, there is no national policies that are going to be able to prevent nothing at all when talking about pandemics. So we should be conscious that true prevention should be global and collective. And if we are not talking in this framework, it's not going to be useful at all. I think also that we are now facing a very concrete moment, a very important moment with a very big challenge when talking about governance, and it's the negotiation for the pandemic treaty. I think also that talking as Secretary of State for Health from Spain, there is something that I would like to outline. I think when talking about technology transfer, many times in the global north, we are talking as if technology transfer will always be from the north to the south. It's not going to be like that, not anymore. The world is not as it used to be 2 decades ago, fortunately. And maybe the next pandemics are going to be faced in a situation that many of the technologies are going to be needed from the south to the north and many others from the north to the south. So maybe now it's the moment also for the northern countries to trying to face or trying to tackle the pandemic treaty from a liberal conception, but true liberal conception. I'm talking about John Rawls' conception and the ignorance veil. So we should face the situation whether we are not going to know in which situation we are going to fall when next pandemic is going to arrive. So we should establish the fair distribution of different, rights and laws and normatives in order to make that the way we are going to face next pandemics, it's going to be fairer than the way we have already done in the last situation. There's also another thing that I think is very important about governance, and it's the public leadership. We have been trying to make possible the interaction between public and private institutions for many years, and I think that the general consensus nowadays is that public and private is not going to be with a very good cooperation if public leadership is not very present. So in our opinion, public leadership should be like the situation we are looking for. But in order to make that public leadership is legitimate, we should have previously the proof, the demonstration that public institutions are able to arrive into consensus, into agreements, to get the correct governance system for the pandemic treaty. And afterwards, I think that we would be more credible when talking about how we are going to lead anything. I think that I'm going to finish with some final reflections. First of all, is that prevention, preparation, and response should be thought from a very comprehensive framework. I think that now in Spain we can be very proud of a model we are trying to develop when we are trying to show how to make the relationship between public and private institutions when talking about pharma products and pharma industry. We are trying to cover the whole value chain of the drugs. So we are trying to get to agreements with the pharma industry from the research and development, but also in the production of drugs, and also in everything related to accessibility and sustainability of our system. So I think when talking about the PPR, about prevention, preparation, and response for pandemics, we should also be talking about how to cover the whole chain. We should be talking about how we are implementing a correct way of R&D, of research and development, in order to have the correct innovations in the future. But we should also be talking about how we are allocating and developing the capacity of the regional production in many other countries globally, and also how we are going to make that all the products we are going to develop are going to be accessible, but also without damaging the sustainability of the national health services. I think that we are in a situation that the global world is facing three main challenges. The first one is about technological and scientific challenge. The second one is about social and economics, and the third one is about environmental. These three topics are also related about how we are governing, financing, and putting into action everything related to prevention, preparation, and response. And we should face that about the techno-scientific challenge. Everything that we are developing should be available for the different countries and should be done from a perspective that takes into account that we are not going to have a market for everything we are going to develop. First, some minutes ago, I was talking about climate change, pandemics, but also about antimicrobial resistance. When talking about PPR, we should be also talking about these three topics. And for instance, about antimicrobial resistance, we should be very conscious that we are trying to develop a viable market for something that has no market. We don't want people to use antibiotics, so we are not going to be able to generate incentives for the pharma industry to develop some drugs that we don't want to be sell and to be used. So we should think a bit out of the box, and we should make the box bigger in order to be comfortable inside this box, but knowing that we cannot create artificially different markets for something that it's not going to be through this market. So to finish, I think that we are now facing a very big challenge about how to prepare for the next pandemics. The next pandemics is not something that can happen or not. It's something that will happen. We don't know when, but we should be very sure that when it happens, it's going to be fairer than it has been the last time. So I think that to finish, there is something that it's very important, is that we are working with public global goods, and for that, we need a strong public global governance. So I'm very eager to hear for everybody who is going to talk now. I want to thank again for the organizing persons and also for all of you that are attending here. Thank you very much, and it's a pleasure for me.
Thank you, Javier Padilla, our Secretary of State for Health. So now is the turn to invite our partners. We have been co-organizing this seminar with IS Global and also with the Central for Global Development. Without them, this event will not be possible. And the good thing is that we have those think tanks that help us to really think and learn all the lessons about the last pandemic and how to be ready. So we will have the remarks and the introduction why this seminar is so important and what for by Rafael Villasan Juan. He's the IS Global Director for Policy and Global Development. He's an expert in all that is related to the governance and the pandemic response. Thank you, Rafael. Do you prefer to be here or there?
So thank you very much. Can you hear me? Yeah. Thank you very much. Thank you, first of all, to the Spanish Embassy for organizing with us, the Ambassador, Angeles Moreno, and Eva, who has been supporting our team and all the team of the Embassy to gather this meeting, this seminar today here in Washington. And thanks for the Center for Global Development. I think that Javier has some problems in arriving here, but in any case, it's a big partner for us with the Institute for Global Health. It's not the first time that we collaborate together. And it's for us very important to keep this kind of both sides of the Atlantic thinking together, thinking on ideas about global health. And it has been a long-standing collaboration since Amanda Glassman at the beginning, now with Javier Guzman, and so on. Thank you also for all the multilaterals, the World Bank, particularly all these people coming today here, and the governments and the European Union, and the many participants for this seminar. And I would also like to thank particularly the Ministry of Health of Spain and his Secretary of State coming here to Washington to open this. For us, it's very, very important that we can bring together the main actors that would be leading with the global health main challenges that we face right now. And we're saying right now because there has been a change in the agenda, a heavy change since COVID-19. And now we have to think about the future. And as the Secretary of State, Javier Padilla, was saying, we have to think a bit more about where are we going, because we know what happened, because we had some lessons, and now we have to take them from there on. So first of all, let me just have 1 minute in terms of explaining why the Institute for Global Health of Barcelona, IS Global, well, we have a kind of different approach from the strict research centers. We were born as a research center, but we have merged into an organization which is also having the capacity to translate the science into impact into society. And that's a big point. We want to know how our best evidence can influence the society. And that's why we are here as well, because we want to impact governments, we want to impact decision makers, we want to work into the path of many regulatory issues, of many capacities to change the agenda for global health in the coming years through the evidence that we can provide. We were at the beginning a center based on the science of environment, climate, and infectious diseases that merge both together. And then from there on, we said, here comes the translation. And the translation always makes a question. What do you want to change with what you are doing? Do you think that you can have impact into society? And that's how, after the COVID, I personally was at the board of Gavi, of the Global Alliance of Vaccine Immunization, representing the civil society seat there during the last 4 years. And we had all these COVAX things and so on. And again, our role was to say, how can we change? And even in this experience, what we have learned is that we need a lot of actors to put them together and to agree on common issues that we can put so that the global health can get improvement. So in a way, we have an advantage as a center, the ES Global, I'm not talking right now about Gavi, which is that during COVID, we learned that science is very important, but knowledge is as well very important. Fresh science is needed. We need new things who are coming, but we also need the whole knowledge that we have in terms of public health to put it together at the times when an emergency comes and say, we have some capacities to influence behaviors, to support governments, to tell the people where are we going, to bring into science what are the issues that we need to cover. And with this idea in mind, we have started at the Institute for Global Health in Barcelona a new hub of action, which is a combination of science and translational capacities on preparedness and response for pandemics. So with an all-hazard approach, we know, as it has been said, we know that the next pandemic will come. We don't know when, we don't know how, we don't know whether it would be much more based on the climate change conditions, on the environment capacities, on the chronic diseases, on the infectious diseases, but we know it will come. And that's why we think that by thinking on preparedness, what we want to do is to have an all-hazard approach, to look at everything, every kind of aspect that can influence the next way in which we have to fight for preventing the pandemic. Why we are here today? What's this seminar for? I think that, well, I've explained a bit our background, but the idea that we had is we are in a path towards how to avoid or how to prevent the consequences for the next pandemic. And in this path, there is a kind of there are big icons there, like the World Health Assembly, next 27th of May will be starting. And then what we want is to be sure that we can put all actors together to see where we are right now. You know how important it's the discussions that we are having right now. And we know that what happens for the next years, it is being discussed right now. After COVID, there are many issues that we need to rethink. There are many issues that we need to be sure that we are putting the efforts in the places and in the resource, in the issues that we think are most important to be sure that we can properly deliver and we cannot fail again whenever a next pandemic comes. So that's why we said it's important to organize these kind of gatherings in which we have, on the one hand, the multilaterals such as World Bank, such as PAHO, such as all these multilateral organizations which deal with the reality of the day by day, the financing, the funding, the resources that we have together, but also governments. What at the end of the day the governments want. And we can no longer think that we have a lot of political will. The increase of political will after COVID is there, but we need to be sure that we can get it, that we can transform that into action. What do we want to change? What are the issues that we need to be sure that we can deliver? That's why it's also important to keep the civil society, which by there, also because there's the voice saying, be careful, you are not considering this, and this, and that's something that we have to bear in mind. So the why now, and the why now, it's clear. We are in this path discussing about pandemic treaty. And what does it mean, or pandemic agreement? Let's see what it comes at the end. The next 27th of May, we will see whether all this work that has been done during the last 2 years would be coming to a good end. And in that sense, we think that this is the time in which we can again retake a look at the final rounds of discussions that are going to be on the lobbies of Geneva at the end of the negotiation, to be sure that we can put the resources there. Because we know that there is will, that's one thing. We need to know whether there would be financing, because expectations need to have resources and need to have responsible for these resources, who is putting the resources, and how decisions are taken, as the Secretary of State was saying a minute before. So it is important that we now have a kind of clear picture of what's doing the US, which is very important. Thanks, USA, because since the beginning you said we will be there in the conference. Thank you also to the Pandemic Fund to come here and discuss, thanks to the European Union. So I think it's important that we can at least understand better where are we now and what do we need to do before we come to a final agreement. So there is one thing that we need to be sure, and that's the whole idea about this seminar. Whenever we have something in common, put it on a paper, whether it's an agreement, a treaty, a regulation, whatever. We need to be sure that is one thing that has been learned from the pandemic, which is that not a single person will be safe in one country. So either we take a stance on going together, or we'll be, again, repeating the failures that we did in the past. So I leave now the floor to the Center for Global Development, our counterpart here, and Javier, thanks for coming. Your turn.
Good morning. Good morning, everyone. Thank you very much for coming. It is a pleasure for us to co-host this event with ICE Global and the Spanish Embassy in the US. It is a very important moment for those who are interested in pandemic preparedness and response. Unfortunately, it's not everyone. Unfortunately, the window of opportunity is closing. Unfortunately, we are at a very critical moment, and we see that not everyone is aligned. But this window is once in a lifetime opportunity to prepare. So for us, it's very important to host this conversation, to understand, to hear, to reflect, to talk about what the role of the European Union, what the role of the US is in these conversations. So the day today is a very interesting day with two main panels and with one initial keynote speak. So the two panels are focusing on two essential elements of the conversation. The first panel is about governance. And in governance, we really need to think about what the situation is at the moment in terms of global conversations, regional conversations, and whether we are or we are not successful at agreeing as the human race at the global level. And if not, what are the alternatives? What are the second best options? Or what happens if the governance arrangements that are based on the multilateral United Nations platform do not materialize? So for that first panel, Gonzalo will moderate, and we are very pleased to have a very team list of speakers who will be with us. As I think I said to some of you, please do have your questions at hand, because we want this to be interactive. We want this to be a conversation. So please do raise your hand whenever we get to that moment. The second panel is a panel on financing. One could argue that financing is a prerequisite for success. And one could argue that it wouldn't be difficult to make the case to finance pandemic preparedness and response after what we saw during the COVID pandemic. But clearly, we're not there. Clearly, the money is not there. And clearly, we need to talk about all the different elements. What money we're talking about, where is that money coming from? What are the trade-offs when we are talking about money for pandemic preparedness and response, and why it is difficult to make the case, even though we just went through a very difficult pandemic. Then we'll have the closing, and for the closing, we have a special treat that is not in the program. Dr. Jeffrey Sack will be doing the closing remotely. He's not in the program, but he has agreed to share his views on this important pandemic preparedness and response topic. So with that, I welcome you again. Thank you very much for being here. I hope we have a very fruitful session. Thank you to my co-hosts, to IS Global and the Spanish Embassy in the US, and let's get started. Thank you.
Thank you so much. So now we're going to have the ambassador, the Spanish ambassador to the US, Ángeles Moreno, and you will see how governments are implied. We are very thankful also for all the embassy's representatives, also for the academia students. So it's an effort that we need to be all the partners together, and we would like to have our view as the Spain's government along with the Ministry of Health. Please, Ambassador.
Thank you, Eva. Eva has been the engine that moved everything to organize this meeting. I'm very pleased to welcome you all here. It is a great exercise to organize this meeting with IS Global, with the Center for Global Development, with the Ministry of Health of Spain, with the European Commission, and with all the partners present here today, when we are ahead of this key date, the 27th of May, when hopefully the governments will be able to reach an agreement on the pandemic agreement. We have learned lessons from COVID. We hope so. We hope we have learned lessons from COVID. It was a good school for mankind, and there are so many threats coming in the health global good that we need to keep on fighting to ensure that our societies will be safe when a new pandemic arises. So this is why it is key that we meet with all partners concerned by this threat: the World Health Organization, the World Bank, the U.S. government, obviously, the U.S. government, Department of State, and the USAID, the PAHO, the International Development Banks, the partners of Spain, Ministry of Foreign Affairs, Ministry of Health, and civil society, the Pandemic Fund for Civil Society, CDG, and IS Global. And we also need to take into account our Global South partners, Latin Americans, Africans, Asians, who were more vulnerable to the threat of the pandemic, and we really need to take into account what they think and how they think they can be better protected in case another pandemic arises. And obviously, within our governments, we need to ensure that we have a good coordination between the different institutions, the different departments. A follow-up has to be also ensured by this agreement, something maybe similar to what we have in the climate agreements, a conference of the parties. And finally, we need to be sure that we provide the adequate financing instruments. We learned the lesson during COVID. Spain has founded consistently all the tools and instruments that were at our reach during the pandemic, and we need definitely to keep on sustaining the pandemic fund at the World Bank and all the instruments that may arise. Spain was among the big donors to the Global South, and we have to make sure that in any next pandemic we can keep this sustainable effort with our Global South partners. We will have also a good opportunity to discuss this during the 4th conference on financing development that will be held in Spain in 2025. And we are very proud to be able to host that fourth summit in Spain. But this is a long time ahead. So let's concentrate on this next week agreement on the 27th of July. And thank you very much for being here today.
Thank you, Ambassador. And now we have our Director General for the United Nations, International Organizations and Human Rights, who will offer the perspective from the Ministry of Foreign Affairs and Global Affairs.
Thank you very much. Can you hear me? Thank you very much, Eva. Thank you very much to the co-organizers of the seminar, to IS Global and to the Center for Global Development, to the Vice Minister of Health and to Ambassador Moreno and her team for setting this. So from the perspective of the Ministry of Foreign Affairs in Madrid, some preliminary considerations on global health. First of all, health is a basic human right. Sometimes we forget that perspective. Governments do have a legal obligation to guarantee universal access to quality health services and to address the causes of disparities in the full enjoyment of this right, being it discrimination, poverty, or whatever cause. Second, ensuring healthy lives and promote well-being for all is also an SDG, SDG 3, and as many other SDGs, its implementation is lagging behind schedule. Although there has been some progress in promoting global health in recent years, the truth is that insufficient progress has been made in different areas, such as, for instance, expanding universal healthcare. So, and also since COVID-19, childhood vaccines have decreased, while TB and malaria deaths have increased. So, as it's already been said, more investment is needed to support countries to recover and to build resilience for next future threats. And the third consideration I wanted to make is that public health and healthcare are also global public goods, and that we all collectively need to preserve them and to prevent risks such as a future pandemic and to respond to those risks once they have materialized. And in order to do so, COVID has shown us, or at least we should have learned, that we have to work from different approaches at the same time. First, we need effective mechanisms for prevention, response, and recovery. It's been already mentioned that negotiations for the treaty are reaching, we are reaching the deadline. We committed collectively in 2021 to have an instrument for this next World Health Assembly, but the time is running out, and we need to make more efforts to overcome our differences so that we have an outcome that is ambitious and that it can respond to the challenges that have been identified. And also, in addition, from a more operational point of view, I think that the Summit of the Future next September in New York offers an opportunity to progress also towards this idea of an emergency platform that could be convened to support the answer of the different bodies of the UN once a crisis once we are facing a crisis. Another line of action that has already been mentioned by and explained by Vice Minister Padilla is that we need to better translate into action our awareness of the linkages between the health of the people and the living beings and the health of the planet, because as we know that climate change is provoking and affecting very negatively all the different factors that determine good health, from food systems to water availability, to clean air, to shelter, and that climate change is going to provoke, to be the cause of many deaths in the next decades, provoked by undernutrition, heat stress, or water and foodborne diseases. And this is why Spain joined the Alliance for Transformative Action on Climate and Health, ATACH, and we are supporting the technical capacity of WHO on climate change and health, and we organized the first global meeting of this alliance, ATACH, in Madrid last March. The third question I would like to touch upon is cooperation. COVID, as Ambassador Moreno was saying, has shown us that we need to really increase our effort in this regard on research, on technology, on investments, And I wanted to inform you that Spain last year passed a new law on international cooperation and solidarity, setting the target of 0.7 of GDP for ODA by 2030. And we are already working to reach that target and that objective. And for instance, in 2023, our cooperation budget for health has more than tripled from the one in 2021. So in 2 years, we have reached the figure of 120 million euros. And just another figure, in 2022, our Prime Minister at the GA pledged 237 million euros for over the next 3 years for SDG 3. And we are channeling that mainly through multilateral contributions to multilateral institutions, WHO, in order to strengthen the governance of the architecture of global health. And Ambassador has mentioned some of the global initiatives in which we have been consistently participating: the Global Fund, Gavi, COVAX, of course, the Pandemic Fund, UNITAID, the Coalition for Pandemic Response and Innovation, or CITAP. And to conclude, I would like to specifically refer to the issue of financing. You know that the high cost of financing for developing countries is sort of pushing them farther and farther away from the targets of the 2030 agenda. And we are aware that access to concessional financing for developing countries needs to be massively increased. We need reforms on multilateral development banks. We need to foster private finance. We need to strengthen the mechanisms for prevention and resolution on debt. We need tax reforms to achieve a more progressive and transparent and efficient tax system. So we are, as a country, as Spain, very committed to contributing to that effort, and that is why we are hosting this next international conference on financing for development. We see it as a big and as a unique opportunity for the international community to agree and to find ambitious but also feasible solutions to overcome some of the obstacles that are hampering the implementation of the 2030 agenda. And we know that it is a big challenge, but we are also sure that the cost of inaction is even bigger. So we know that we need to get to good results in that conference. We hope that new amounts of money can be committed at an affordable cost, being through SDGs, rechanneling, or other. We expect progress in the negotiations of a tax framework convention, also in the design of new criteria for allocation of concessional funds that goes beyond the criteria of income and succeeds into incorporating the perspective of the vulnerabilities and inequalities that also affect middle-income countries. We expect also progress in reducing the cost of financing. The quality also of financing must be improved in order to improve its ownership, or to incorporate the localization of SDGs or the mainstreaming of gender and human rights. We want also the conference to reinforce the inclusiveness of the discussions. And of course, it will be necessary to transfer the outcomes and the decisions that are taken there to other decision-making processes in other fora. So if we are able to achieve this and to move forward, we think that the conference will be a unique opportunity to rebuild some of this trust that it's being eroded in the international context in the recent years. So I will not refer to other relevant issues because of the time, technology, misinformation, disinformation, and I would just like to conclude by saying that the solutions, we know which ones they are. They require resource mobilization. They require strengthened collaboration among all the partners, but most of all, they require political will. So I encourage us, each of us in our different lines of work, to help to build that political will and to translate it into action so that we can have a world that is healthier and that is safer for all the persons. Thank you very much.
Thank you so much, Cecilia, our director, for all the insightful remarks and the engagement and the encouragement. So now is the time for the panelists. Please, the first panel, Gonzalo Fanjul will be the moderator for the Institute of Health. you have the program, and we have the representation of the civil society from the Pandemic Fund, also from the State Department, and we have from the European Union delegation. And you will have the panelists that cannot be in person, but they are in spirit, and they are connected from the WHO, Jim Campbell, and Ciro Ugarte, he's in Guatemala. So the floor is yours. We'll open the first panel.
Thank you very much, Eva. And thanks everyone for being here, and our panelists here and online for joining us. As Javier explained before, this is going to be the first of our two roundtables. It is going to be focused on the governance aspects. As Eva said, my name is Gonzalo Fanjul. I am Policy Director at the Barcelona Institute for Global Health, and we've been following very closely this fascinating topic, and I hope that we have the chance for a fascinating conversation today. No? I think that it is fair to say that there is nothing new in the global aim to govern global health, to govern the kind of systemic risks that we are facing right now, that we have seen during the pandemic. And we've been, for decades already, trying very slowly and very painfully to build the kind of institutions and norms that will allow us to prevent and to respond to these threats, in particular infectious diseases, but not only infectious diseases, as we very well know. No? But it took a planetary tragedy of the size of the pandemic that we just went through to simply evaporate many of the political barriers that had been a formidable obstacle before that, to find the kind of institutional and legal creativity and innovation that is necessary to create issues, to resolve problems that are new, and to finance this effort with an extraordinary financial and fiscal support, particularly from developed countries, but certainly not alone, not just from developed countries. No? I was just thinking on the top of my head of some examples of this innovation. Well, first of all, we saw how things that seemed to be impossible, such as using, before the pandemic, such as using the margin of action that we had on the existing treaties, for instance, the WTO waiver on TRIPS, on intellectual property, that for the first time was proposed by an American president, no less, which is something that we had not seen in the past. Just the very use of that margin of action, I think that was extremely innovative. We saw the creation of a massive vaccine procurement and distribution mechanism such as COVAX that has revolutionized the way we faced the needs of global immunization during a global emergency like this one. We saw the establishment of brand new prevention authorities such as HERA in the case of the European Union, which was created during the pandemic, or we saw the creation of the Pandemic Fund, a completely new financial facility in this case to finance the efforts of low and middle income countries in the prevention and response to this. No? So we have already gone we have already gone far during the years of the pandemic, no? But I don't think there is anything more symbolic in this regard than the so-called pandemic accord. What started being a pandemic treaty, now it's an accord, and let's hope that it is something more than a headline when this process finishes, with this process of negotiation finishes, no? But the fact is that there is a lot of symbolism in the first fundamental global effort to coordinate the response of all countries and of all parties, not just countries, but civil society, scientific community, private and public actors in the prevention and response of global pandemics. No? This is going to be a litmus test for everybody. It is going to be a proof of how close this window of opportunity that Javier and Rafa were referring to is already closed or not. What was evident for everybody back in 2022 or 2021 is not so evident in the context of a increasingly polarized world where we have competing emergencies, when the interest of the public opinion and the interest of many of our leaders have already moved to something else. And what seemed evident at that point, that this treaty is necessary or this accord is necessary, is not necessarily evident anymore. No? This is, there was this fantastic piece written by Stephen Walt and Danny Roderick in Foreign Affairs back in the summer, talking about how in the middle of this extremely challenging context, in the middle of this geopolitical meltdown that we are living in, it was still possible to rescue certain aspects where the international community understood that an agreement was in the benefit of everybody. And they obviously refer to the nuclear treaty, I mean, the extension of the nuclear treaty, but they mention global health as something that even in the middle of this situation is something that we need, where we need to maintain a minimum level of coordination and a minimum level of goodwill to guarantee this global public good. No? In part, this is related to the reference to mutual interdependence that Secretary Padilla did before. No? So this is what we are going to talk about in this roundtable. It's about what we need, the kind of systems that we need, the kind of norms, the kind of institutions that we need. Of course, this is referred to the pandemic treaty, but I think that governance goes far beyond at the regional level and even at the national or bilateral level, as we are seeing in many regions, such as Latin America, where we are working a lot. We are going to talk about not just what we want, but what we can honestly expect out of these negotiations, out of the realpolitik of these negotiations that are taking place. And we are going to talk about the role that each of these actors should play. The governments, of course, but also the regional institutions such as the European Union. As you know, the European Union is negotiating with one voice in these negotiations. What we can expect from the civil society, what we can expect from the scientific community. No? And to discuss this, we have a privileged, really an outstanding panel. I will just introduce the names of the people that are going to be here. Online, the first to intervene will be Jean Campbell, who is the Director of Human Health Workforce at the sorry? He's here, at the WHO. Then we have Hilary Carter here with us. She's the Acting Principal Deputy Coordinator for Global Health Security and Diplomacy in the US Department of State. Then we have Javier Sancho, also here with us. He's the Head of Global Issues and Innovation at the EU Delegation to the United States. Then we have Ciro Ugarte, also will be accompanying us online. He had to travel to Guatemala unexpectedly, and he will be joining us from Guatemala. He's the Director for Health Emergencies at the Pan American Health Organization. And finally, we have Elisha Dan Giorgio, who's a Pandemic Fund board member, and also, representing Northern Civil Society in the board, and also the President and CEO of the Global Health Council. Okay, so with these 5 partners, we will have a conversation. What we have agreed is to have 2 rounds of interventions. I implore you to be disciplined, because we don't have. We want really to have the possibility of the intervention and a dialogue with the public. I have requested them to make 5-6 minutes interventions for 2 rounds of questions. No? And the first question is referred to the context in which this conversation is taking place, to the dating context, I would say, in which this conversation is taking place. No? In the midst of a global geopolitical crisis that is challenging our traditional governance models, the way we have operated in the past, how do we ensure basic agreements on pandemic prevention and response as a global public good? What can the countries and organizations you represent contribute to achieve this? No? So, Jim, if you are okay, we are going to start with you, and then we will follow here. Okay.
Thank you very much.
I think your voice is silenced, Jim. Maybe your micro.
You should be able to hear.
No, we cannot hear you.
We can hear you.
Maybe we switched off before when the. By the way, I need to clarify that to the best of our understanding, none of the people in the panel was depicted in the images before. Jim, can we
Try
hear you?
again, test.
Yes,
one,
yes,
two,
yes.
three. Now we're through. Okay. This time the right intervention rather than the unofficial. So, Gonzalo, thank you very much. Secretary Javier Padilla, Ambassador Angeles Moreno, colleagues from IS Global Center for Global Development Fellow Panelists. Let me offer to Gonzalo's question of public health response rather than the country or the organization response in particular. And that public health response really coming from the lens of sort of people, planet, peace, and prosperity. And the question about global public goods. So we know that common goods for health, global public goods, are fundamental to protecting and promoting health and well-being. They have broad benefits and they cut across multiple sectors. And to enable those, we need strategic action and investment by government and partners. And that's the title of today's, from negotiation to action. Let me offer you a couple of examples then of how evident some of these common public goods for health have been during the pandemic, and then bring it into today's scenario. And I'll pick two examples which are related to the American and Spanish theme today and the connections, as Javier Guzman put it a moment ago. What is the role of the EU? What's the role of the US? Firstly, early in the pandemic, 2020, 2021, Professor Mario Monti, the former Prime Minister of Italy, convened the Pan-European Commission on Health and Sustainable Development, looked at the process with European experts, including former ministers, institutions and involved in there, and looking, as you said a moment ago, Gonzalo, this planetary tragedy that was unfolding. And that work, that expert group concluded that we had catastrophically failed to manage the defining crisis of our time. Our public goods, our capacity, our investment in public health have not been there. And 7 recommendations that they put forward. 3 of which: health surveillance, early warning systems, crisis response must be strengthened. That we need greater investment in the health systems and the health workforce to be able to prevent and respond in the future. And inclusively on a governance, promoted the idea and the concept of a pandemic treaty. Fast forward 22-23, and this occasion, Secretary of State Antony Blinken convening ministries of foreign affairs and from around the world in the COVID-19 Global Action Plan for enhanced engagement. That had the EU represented, it had the Africa CDC, the 55 countries there in the CDC, plus about almost 30 countries from around the world. So over 100 countries in total. And their consensus that they were coming further forward. And the Minister of Foreign Affairs, Jose Manuel Alvarez, was part of this group and chaired one of the working groups in the Spanish Foreign Affairs. And the pandemic response, get shots in arms, but also let's strengthen early warning systems. Let's invest in the health systems and the people that operate them, and welcomed this whole approach around national capacity to deliver the essential public health functions and build that system capacity for the future, and strengthening, again, the global health security architecture, including the role of WHO. So whilst your question was, Gonzalo, was sort of saying the breakdown of sort of global order, what we're seeing is clear convergence and consensus amongst many, many member states, amongst many, many experts. There is recognition. Global threats require a global response. There's a responsibility to protect people and the planet, and that requires intentional action and investment in health systems, health workforce, surveillance, early warning, and a pandemic treaty, the global health governance. And then crucially, as Cecilia mentioned in her remarks a moment ago, we then need the investment that comes with that governance instrument. So I'm a little more positive, I'm a little bit more optimistic. Global diplomacy has been at this for generations, and even though they are challenged with other competing areas, it will come back to protecting people, planet, peace and prosperity. Thank you.
Thank you very much, Jim, for your intervention. And I'm really glad that you are optimistic because, I mean, sitting in Geneva right now you have, I think, possibly a great perspective of what is happening. Hillary, if we can continue with you. Thank you.
Thank you very much, Gonzalo. It's really a pleasure to be here with you all. Good morning. I want to thank the government of Spain, Secretary Padilla, Ambassador Moreno for hosting this. I want to thank the Institute for Global Health in Barcelona for the partnership and also the Center for Global Development. This is indeed an important conversation at an important time. So I want to pick up on some of the comments that were made earlier about what we've learned from COVID, because we've learned a lot. Some of the things we knew, but we saw different dimensions as we all have this shared experience with COVID. I think in particular, we learned that it is not just a health issue. It's an issue that affects security. It's an issue that affects our economies, and it's an issue that can lead to humanitarian crises. I think we also learned that international cooperation is essential for effective response and also preparedness for that response. And we learned, or maybe learned in a new way, that pandemics do not respect borders and that we must partner with all countries when there's a pandemic that happens, even with countries that we do not agree with. And so in this context, Secretary of State Anthony Blinken launched the bureau that I represent, the Bureau of Global Health Security and Diplomacy. And our bureau is led by Ambassador John Nkengasong, who also serves as the Global AIDS Coordinator and the Senior Bureau Official for Global Health Security and Diplomacy. And he's been nominated for a new role in the US government, which is the Ambassador at Large for Global Health Security. And when I think about Ambassador Nkengasong, one of the things that he impresses upon us is the 4 C's: cooperation, coordination, communication, and collaboration. And so thinking about your question and pulling out the communication piece, I think we need to be really clear about the stakes for countries and communities of this issue. I think we are just beginning to see the impacts of COVID come into sharp focus. And The Lancet published a study recently that showed a 1.3-year decline in life expectancy. And this is the first time that we've seen that since the 1990s when they started keeping track of life expectancy. This is from 2019 to 2021. And so what do we do about it? What are we doing about it? What can we do about it? I want to highlight 2 things that the US government is working on, and in particular, our bureau. The first is, and I have a very good setup from Jim and his comments on the Global Action Plan. We have taken the Global Action Plan, which, as he noted, was a forum for foreign ministries to come together during the COVID response and coordinate response actions, coordinate commitments, coordinate leadership and political will. And we've transformed that into an enduring channel. And we're really pleased that the government of Spain and the EU and a total of 18 countries launched the Foreign Ministry Channel for Health Security on March 14th of this year. And this Foreign Ministry Channel is looking to establish that communication line so that we can better cooperate, better collaborate now and also when we're in the next pandemic situation. There are 5 lines of effort for this that are still, in the early stages of development, but include things like countering mis and disinformation, One Health, early warning, medical countermeasures for health emergencies. And we're really looking forward to just next month when Australia will host the next iteration of the Foreign Ministry Channel on the margins of their Global Health Security Summit. I'll highlight just one more example of things that the US government is doing in partnership with countries around the world. And that is last month, we announced the expansion of our bilateral partner countries from 26 countries to 50 countries. And you will hear more about this on the next panel from my colleague at USAID, Nidhi Bori, who's one of the primary implementers of this program. But I just wanted to pull out a couple of success stories and also direct you to a new US government website on our global health security partnership and the US government's approach to global health security, which can be found on the State Department server. So just very quickly, 4 examples of bilateral partnerships. In the DRC, we're supporting national lab policy, which includes biosafety, biosecurity, and quality assurance. With Bangladesh, we're supporting infectious disease guidelines, treatment guidelines, and appropriate antibiotic use. With Guatemala, we're partnering on a national rural vaccination plan. And with the Philippines, we're partnering with the Department of Health to counter mis and disinformation and to put out appropriate public health messaging. So I will end there and thank you all for being here.
Thank you, Hilary. I don't want to put you on the spot, but I'm going to ask the same question to Javier. But to what extent do you think that the political gravitas or the political leverage that your government has provided to this topic is well rooted, or does it depend on your government changing next elections, your Congress changing? I mean, to what extent this is something embedded in the political will of the American society, or you think that we might be in a different scenario should the government change? No?
Yeah, so I won't comment directly on kind of the political situation, but what I will say is I have been really excited and encouraged by the reaction and the reception to the Foreign Ministry channel. I think, you know, with the launch event on March 14th and the side conversations that happen, there is an excitement, there is an understanding of what foreign ministries can bring to this problem set. It includes, you know, interest in training the diplomatic corps, our respective diplomatic corps around the world. There is a growing cadre of global health ambassadors who reside at foreign ministries. So these are really important signals that the technical agencies, the ministries of health, the corresponding centers for disease control have really critical roles to play. And the foreign ministries have a role in supporting that work and mobilizing the political capital so that technical work can be done.
Thank you very much. It's encouraging, really. Normally, these conversations about the treaty are a funeral, and with Jim and Hilary, and it's a Javier. Let's continue with you on the position of the European Union on this.
Okay. Thank you very much. Well, since I'm the third Javier addressing you today, it's not normal, but I will try to be à la hauteur here because so first of all, thank you, of course, for inviting us to be here. Hilary said very rightly that this is not only an important conversation, it's also a timely one. And you referred to what's going on in Geneva. We are, of course, following that very closely from here, even if we are not directly involved in the negotiations. You also said, it is true, that the European Union member states are, because there is a mandate for the Commission for the negotiation of the agreement. So, but I will start by saying that we have been referring here to the fact that COVID was, that so many lessons that we should have learned from what we all experienced. But you know, also the humans are very good at not doing that. And you also agree that viruses and pandemics and other man-made and natural disasters do not respect borders. So it is obvious, and maybe we should state again and again what is maybe obvious, and is that actually we need cooperation more than ever. And we believe in multilateral action as well. Also, this, I like what you said, Hilary, that this is not a health issue. It's not. And these things which from some time or some time ago were just technical issues discussed at the end of a corridor in Geneva, or what this now lies at the very heart of geopolitics. And therefore, these multilateral actions should be coordinated, and we need to equip ourselves with the governance tools that we need to do that effectively. Because it is good to talk, but we need to walk the talk. And for that, you need good governance, solid structures which are able to do that. So your question was about, okay, how can, I mean, the European Union that I represent here, what is it that we are doing to achieve these goals? And the first thing I would like to say is that the idea at the beginning was, let us reshuffle the whole thing. And then we are building, developing, and creating the building blocks to establish a European health union. And it is in this framework that we are doing what we are doing. You refer to HERA, which I think is a very, very successful decision. I mean, recently we saw with the emergence of Mpox in the European Union how useful HERA is. It worked very well. But we also reinforced the mandate for the European Medicines Agency. And we have actually a colleague of ours from EMA embedded in here in the what's it, CDC. So working together with the Americans. Also, we reinforce the mandate of the European Center for Disease Prevention and Control, the ECDC. And finally, of course, we need fit-for-purpose regulations and legislation. Sometimes from the US, we in the European Union, we are seen as compulsive regulators, that we want to regulate everything. Actually, we need to regulate what we need to regulate. And we need to do it quickly because, of course, we need to take action swiftly. And we are representing 27 sovereign entities, so it takes a lot of time to reach that point. Also, I would like to stress something that I heard here and the first Javier mentioned, and it was this transfer from the south to the north. I like that idea very much because, as I was saying before, we need to discuss this in geopolitical terms as well. And when you talk to the global south, which is the best way we have found to refer to a very diverse group of partners, we like to call them partners in development. When you talked about the global south and how upset they still are about what happened during the COVID pandemic, this is a message that we need to understand, not only here, we need to understand, and we need to understand the rationale behind them telling us that. And for that, maybe in the second round of interventions, I would like to refer to a few very specific initiatives that we are taking precisely to do or to try to help reaching that goal. About the pandemic agreement, with that I will finish. The problem with multilateral action, of course, is that it is very easy to just limit ourselves to the lowest common denominator, and that is not enough. So this light agreement that people are talking about, just in case the negotiations fail, of course, we will take whatever we have and work with that. But if we are ambitious, it's precisely because this is important. I've seen from the other side, precisely because we are very ambitious, we need to be very pragmatic, precisely because of that. But we cannot lower our ambition, because otherwise the outcome will not be enough. I think it was Rafael who mentioned the fact that the political will is there, and you feel it, but we need to find the right incentives. So not only governments, also pharmaceutical, businesses feel comfortable with the outcome and therefore push for this will to be transformed and translated into not a lowest common denominator, but something which is closer to the level of ambition that we all would like to have. Thank you.
Thank you very much, Javier. Maybe later, I mean, you have referred to the medicines.
Sorry, I didn't respond to the question you asked Hillary because she did it so well.
Yeah, no, but I'm coming back to you now. But you've mentioned medicines. I think that this is one of the litmus tests of the negotiations. What happens with what we saw as a fundamental failure in the response to the pandemic, which is the profound inequalities in the distribution of diagnostics, vaccines, and diagnostics, vaccines, and treatments during the pandemic, no? And the need to regulate a better system of production, not just a fairer one, but a more efficient one. No? But Javier, no, my question is, I mean, it's interesting in the case of the European Union because the negotiations are taking place this very month. The European Union is changing its parliament on the 9th of June, as we very well know. And it is fair to say that there is a push by national populist movements that do not precisely agree with the kind of things that we are discussing here today, no? And my question is, I mean, to put it very simply, is, I mean, are there reasons to maintain the optimism after that? You think that the fundamentals are strong enough so that it will not?
Yeah, I will be, of course, I can answer you as a citizen, but I don't think you are interested in my personal opinion. We will talk about that later. But I think that from the European Union perspective, and you can also refer to that if the conversation will be about, for instance, the fight against climate change or the digital transition, I think that what we have been doing the last few years is building a very ambitious regulatory framework. Our targets for climate change, fight against climate change, are not just political statements, they are law. Therefore, if you want to dismantle that from certain political perspectives, you need a lot of political will behind an agreement. So I do believe that building these regulatory frameworks, not just one or two, but a structure, a solid framework of regulations is the best guarantee we have to keep on moving in the right direction.
That's a very fair point. Thank you very much, Javier. Okay, so let's, Firo, I can see you there. Let's move to now to Firo. You have the perspective of an institution that has been at the trenches of the response, and I think that's your vision here, I think, will bring a distinctive added value. So please go ahead with this first question, Firo.
Thank you so much, Gonzalo. Thank you so much for inviting Pajo to this meeting. And I would like to begin with the words of failure during the pandemic, because it's at the core of every decision that is being negotiated and taken all over the world at the different levels. And I think the main concern is to properly identify where the failures were. And there is something big missing around that topic. And it is an independent external evaluation of the response of the main actors to the pandemic. And I think if we do not properly identify which are the failures that we faced, and identify from a different perspective, external independent perspective, we will most probably look for many solutions that may not fulfill the challenges or the problems that we face. And regarding the issues of health aspects at the center of this, we know for many years, decades actually, that health emergencies are first political, economic, and social before the health systems and services are coping with many patients. So it is extremely important to involve all those actors from the beginning. It is not even WHO or PAHO or the health sector at the center. It is the health of the people at the center. So that is a core input that we need to insert in all the negotiations. Otherwise, we will move towards other problems outside the health and well-being of the people. The other aspect is that the world is organized in groups of countries and regions, and in the countries of the Americas, the director of PAHO decided to convene the ministries of foreign affairs, who are the ones who are dealing with the negotiations, and the ministries of health at the capitals of each of the countries to discuss everything that is being discussed. And we had already 4 meetings, recognizing that this is not the health at the center, it is the health of the people at the center. But the national authorities are the first and last, utmost responsible for the well-being and health of their people. So they must be part of these agreements. I mean, the capitals, not necessarily only through the missions in New York or Geneva. That's extremely important, particularly because in the negotiations, most of the timing of the negotiations begin, as I am now in Guatemala, it will begin at 1 a.m. Guatemala time. And in many countries, it will be 3 a.m. So it is almost impossible to fully follow the negotiations. But also I would like to highlight some other aspect that is what we call lessons learned. I think we don't usually learn the lessons. We do reports, very nice reports, but then the action itself is not done at the level that we need. But because the region of the Americas was the hardest hit region in the world, because of all the inequalities that we face and many other things, and the global supply chain failure, more cases, more deaths per cases happen in the Americas, and the economic impact is so huge that there are already several regional provisions to counteract a new emergency or new pandemic, because we know that we cannot fail our member states. If the countries in the Americas did not make the decision to have a strategic stockpile of essential supplies and personal protective equipment in Panama 10 years ago, probably the number of healthcare workers that died during the early stages of the pandemic will be higher even. So that's extremely important, the regional production, etc. But with a caveat. We cannot survive only on regional approaches. It must be fully linked and fully aligned and take into consideration the global and specific countries' priorities and capacities. And that's the way that we see governance in this area. It must be governed by the member states. It cannot be an independent institution. And it is. The negotiations are looking for the member states to take the decisions. But you know very well, and we are discussing now, that it is not the health sector who will have the last call. The last call is political, it's economic, it's social. And in many aspects, if the social media is saying that a new pandemic accord will take the sovereignty of the countries, of the people, you know, that's a big problem for reaching an agreement. And Hillary mentioned that pandemics do not respect borders. But I've seen in many disasters and emergencies that maybe the pathogen will not respect borders, but clearly disasters. We see that even in the same community, some communities are more hardly affected. And it happens also in pandemics. And that's why it is not necessarily that we can, protect ourselves at the borders, but we must protect inside. And that is the biggest challenge that countries face, expecting that somebody will come with funding to help the countries is a dream that most probably will turn into a nightmare. It is the national decision to strengthen their capacities to deal with these emergencies. Thank you, Gonzalo.
Thank you very much, Ciro. Later, I want to come back to the particular situation of middle-income countries in this process, and I think that the region of the Americas is interesting in this regard because somehow they were caught in the middle during the pandemic, no, in a territory of nowhere, of no one, no. But let me finish this round with Elisha and the position of the civil society, or at least your civil society, and what you think about this first question.
Thank you. Thank you, Gonzalo, and thank you to the organizers and the Embassy of Spain for having me here, and to my esteemed panelists. I am as Gonzalo said, the civil society Global North representative on the Pandemic Fund Governing Board. And I also run an NGO here in Washington, D.C. called Global Health Council. And we are an official, a non-state actor in official relations with the World Health Organization. So we've been following the Pandemic Accord agreement, started as a treaty, now it's an agreement, talks quite closely and giving feedback when asked. Although I think, as you all know, civil society has not been actively or routinely engaged in the conversation. So to the earlier point about having a people-centered voice, that has largely been absent from the beginning. Although I will say the United States has made a valiant effort to engage civil society as appropriate. So I think, coming out of COVID or during COVID, there was quite a bit of momentum. As you said, people, countries, governments recognized that we needed to think differently about cooperation and collaboration in the multilateral space. And so that was the beginnings officially of the pandemic agreement negotiations. Also the establishment of the Pandemic Fund, which is a multilateral body where low and middle income and high income countries, as well as non-state actors like philanthropies and civil society, come together routinely to discuss pandemic preparedness and response. So that does exist. I think, you know, obviously the agreement at WHO is a larger scope, and we all hoped it would be binding. But that doesn't look like it's going to happen, not to bring the funeral. I feel like that's where you always save civil society to last. But I think the question about that momentum is, can we sustain it? I think, Javier, you alluded to this, but you know, human beings aren't great about behavior change, right? Overall. I mean, if you think about when you make a New Year's resolution, you know, January, you start off with a bang, you're going to the gym every day, you're eating well. February, well, maybe you're going 2 or 3 days a week to the gym, you start to eat some chocolate, and then, you know, by April, you give up the membership. So I think the hope is that we're not seeing that pattern. And honestly, it's refreshing to hear the examples from the US and the EU about the kinds of things that they're still trying to implement and create in order to address pandemic preparedness and response. I think one of the things that's important to keep in mind, that momentum was not solely about high-income countries helping and being more equitable with low and middle income countries, although that certainly was a huge, huge issue and highlight that we saw throughout COVID, and just a horrible inequity in response and access to medicines and treatment. But the momentum coming out of COVID was that every country needed to strengthen their health systems. High-income countries, low-income countries, middle-income countries. I live in the United States. I lived here during COVID. I don't know if those of you in the room did. We didn't do a great job, right? During COVID, we had a lot of problems. And as a high-income country that has established public health institutions, that has established protocols, that has some of the, you know, highest health resources in the world, we fared terribly during the pandemic. And so going into these conversations in the multilateral spaces, it's not solely about those global interactions. It's also about what each nation is going to do to strengthen its own health system. And I think in that piece, again, it's been a real oversight not to engage civil society and communities, because it's not just about, you know, civil society and communities being the implementers and we come to them and we ask them to reach out to the community after the fact. I mean, we heard about the disinformation campaigns. We know that that is going on not just in the US, but in other countries as well. Civil society is excellent at campaigning, right? That's one of the things that we do and really could have been mobilized more intentionally by governments at the beginning of these negotiations to really strategize and partner as we move forward, understanding that we don't have the same duty, you know, of burden of duty that a government has. We're not running a country, but we do have ideas and insight that could have helped move this process along. And so I think that, you know, one of the bright spots is Pandemic Fund, is other multilateral mechanisms like Global Fund, like Gavi, that engage civil society from the beginning in the co-creation of programming and resource mobilization. And that would be a wonderful thing to see in the pandemic agreement coming out.
Thank you very much, Elisha. Okay, I think that we have a general understanding, very optimistic, I must say, in the about what are the trends right now and what is the context. And now I would like us to try to get into more specific topics, no? And more specifically, what is it that we should expect from these negotiations, what we should aspire to, and how far you think that we are from there? What is it that we can honestly expect from the current status? And I would like you to be as specific as possible, and also about the way different partners should move in that regard. Your own, I mean, the kind of the governments and institutions that you represent, or the sectors that you represent, but also maybe where you think that the key obstacles are in this regard. No? And let's try to make, because we are a little bit over time in this regard, if we can make it short, and then we can open the conversation with the public. Hilary, if you want, we can. No, sorry. Let me start with Jim as we did before. Sorry, Jim, please go ahead. Jim, if you can speak up, because for some reason we can. Your voice is a little bit low in this. Thank you.
I'm not normally accused of that. So okay, fascinating. So just on what can we expect? Firstly, let's just huge acknowledgement to the work of the IMB Bureau, the co-chairs and the vice chairs over the last 2 years, for the effort and the work that's gone through, and to my colleagues in the WHO Secretariat who've been supporting the Bureau, not least then the member states that have been actively engaged. We're on the 9th meeting, and that will resume again from the 20th of May, just before the Assembly. You people were mentioning the 27th of May when the Assembly convenes, but we've got on the 26th of May, we've got the event to walk the talk. It's when the health constituency, the delegations all come together to walk the talk. And perhaps that's the theme that we're going to be looking for in the Assembly itself. Dr. Tedros has asked member states and the constituencies to get the pandemic agreement done, to get it done. What can we expect? Again, I'm an eternal optimist. I can see this convergence, this consensus that's coming through. But we've got 3 chapters, 37 articles, a core objective, which you've all been talking about, which is guided by equity to ensure that we prevent, prepare, and respond to pandemics. That objective people are consistently in agreement with, but it's then into the details that we need to go. Both Ciro and Alicia have mentioned some of the disinformation, some of the campaigns against us, the social media and the perspectives that are informing and influencing delegations and their perspectives. But let's just call that out for what it is. The co-chairs and the vice chairs have published evidence in the Lancet, their perspective. The sovereignty of the people is not under threat. The pandemic agreement puts full sovereignty and solidarity with the people at its core. And so let's call out this misinformation and come further through. We're seeing, the text that now taking shape. There are a few issues still to land next week, and some of those issues around financing, around access to technologies. But again, I think if you come back to the chapter heading that those articles come under, which is around the world together, trying to take these actions. Again, I'm just really optimistic and hopeful that the science, the evidence, the public health ethos will come to bear and come further forward. And then, as we go into the implementation arrangements, we still need, as we heard from our US colleague there, we still need ministries of foreign affairs. We still need, as Javier, number 1, was talking about the role of the public and private sector, the role of the pharmaceutical industry. We still need partnerships to drive it further forward when we come out of the Assembly. And as I said, just to walk, talk, and to get the job done. Thank you.
Jim, in your experience, you don't need to respond to this if you don't want, but the idea of the conference of parties that has been raised lately, the idea of establishing some kind of mechanism that is similar to the climate negotiations, for instance, it would allow us to at least to continue, to try to aspire to an incremental process. Do you think that's a good idea? You think that is going to help the process, or?
Gonzalo, I wouldn't sort of come back to sort of personal opinion and reflection here. I'd go back to the evidence. What we know, and come to your first question about the global multilateralism and everything else. We've got evidence that conference of parties can help drive an agenda further forward across different topics, across different issues. And if member states are willing to fully engage in that in the agreement, then let's go with the evidence base for that action that's necessary.
Okay, thank you very much, Jim. Hilary, we can continue with you.
Yeah, thank you, Gonzalo. I don't know that I'm going to get as specific as you would like, but I will try to deliver here. So I think, as it relates to this question, I want to highlight a recent statement that was submitted or published by Secretary Blinken and Secretary Becerra that communicated the way in which the US is showing up into these negotiations on the pandemic accord. And so that hopefully gives you a sense, the level at which this is being reviewed and vetted and how the US is showing up in these negotiations. More broadly, I think our priorities have remained the same for pandemic preparedness and response. You've heard me talk about enhancing capacities for global health security and PPR. That's priority number one. Priority number two is countries sharing data and samples quickly, transparently, so that medical countermeasures can be developed. And then priority number three, which goes hand in hand with priority number two, is supporting equitable access to the delivery of medical countermeasures. And in doing so, containing outbreaks quickly, reducing illness, reducing death, reducing suffering, and also reducing those impacts that we talked about previously on the economy, on livelihoods. I want to pivot a little bit and talk about the Global Health Security Strategy, which was released just last month by the White House. And this strategy has three goals. The first goal is on providing bilateral capacity building support. And as I noted before, the US has expanded those partnerships from 26 to 50 countries. But also we are using those partnerships and working with other partners to catalyze additional action and additional partnerships to reach the G7 commitment that the US has signed up for on supporting 100 countries through bilateral global health security partnerships. I also want to talk about goal 2 of the strategy, which is related to catalyzing political commitment, financing, and leadership to achieve health security. Elisha talked about the pandemic fund. You'll hear from my colleague Priya Basu on the next panel about the pandemic fund. But I did want to highlight from the US perspective, for this administration, it has been a day one priority and remains a priority. If you look at the broader global health security architecture, this fund is filling a critical gap for supporting those capacities, including as it relates to the IHRs. And so it remains really important. Ambassador Nkengasong is the board chair for the US government in partnership with the Treasury Department. And we have been very focused, and he has been laser focused on working within the board context on the strategy, the 5-year strategy, which will hopefully be launched in just a few short weeks. Looking to the future, we will be very focused on resource mobilization for the fund. This is a very important year for that. It's a difficult year. But working with the board and hopefully with all of you and others on strategies to get double contributions into the fund itself and think about other innovative ways to support the fund. I want to next talk about goal 3, and then I'll conclude, because goal 3 of the global health security, I think, is really important as well. And that is on linking complementary programs for health security impact. And in particular, what this means for our Bureau is linking the work that has been done by the very successful PEPFAR program, the President's Emergency Plan for AIDS Relief, with broader health security objectives. So PEPFAR, I'm sure, is probably well known in this audience, but if it's not, it has enjoyed 21 years of bipartisan support. That's 4 presidents, 10 Congresses. The US has invested $110 billion into PEPFAR through the Global Fund and through supporting 55 countries. And the impacts, speak for themselves. 25.5 million lives saved, 5.5 million babies born HIV-free. And this profound, these investments and this work with many of you has had a profound impact on the trajectory of one of the most deadly and challenging pandemics. And as we look to the future, supporting the goal of ending HIV/AIDS as a public health threat by 2030. The PEPFAR program's impacts relate to health security and extend quite significantly into health security while remaining laser focused on the primary goal of HIV. This includes strengthening lab networks. It includes building supply chains, training health workforce, and also supporting diseases that disproportionately affect people living with HIV, such as Mpox and TB. I think in the interest of time, I won't go through more specific examples, but I think when it comes, just to conclude, I think thinking about the 4 Cs coupled with concrete actions give us the best chance to deliver health security for communities and countries all over the world. Thank you.
Thank you, Hilary. I want to push you, in particular you two, a little bit more on this, because I struggle to explain to a broader audience, non-specialized audience, what is it exactly that will change after this accord after this accord moves forward, no? That's why I was trying to be specific. What changes in terms of access, in particularly in low and middle income countries? What changes in terms of transparency, in terms of financing and compensation for the countries that say? So I'd like to, well, Javier, please go ahead with your response, but I'd like in this conversation to be as specific as possible for the people to understand why this agreement is important, or is a missed opportunity, by the way.
Gonzalo, to be very specific when negotiations are ongoing is very difficult, particularly if you are representing, in my case, an organization representing itself 27 sovereign entities. It's very difficult to go specific. I think that we need to limit ourselves to a couple of things. The first one is to stay focused on what was the original intention and the original plan, and that is very simple. The objective was improving prevention, preparedness, and response. So this is the goal. And the way from this original intention and objective and the final outcome is what we are now on that precise way, path. So it's very difficult to be specific. And so bear with us in that sense. We cannot be very specific. I don't have the telephone number of our negotiators in Geneva and ask them, so what's going on? Are we going to hell? We don't know. I would say also that I referred before to the European Health Union, but also we have a global health strategy. And it's in that framework in which we are doing other things, not only participating actively and proactively in the negotiations in Geneva, but we are doing many other things. For instance, I think it is important to highlight the relationship with the fact that our global health agenda and the G20 Brazilian presidency agenda are very much in sync. And that's a good opportunity that we are, of course, determined to seize, because we need to look for synergies with other groups of regional groupings which are so important as we want to accelerate action. I would also refer to the fact that the pandemic fund, and we have Priya Basu with us today, the commitment of the European Union and its member states is not only solid, it's real. And we don't believe, and I think it was Cecilia, Director General Robles before, who referred to the importance of sustainable financing, and the fact that this is a key, crucial element in the pandemic agreement, discussions and debates and conversations. I believe that there is no need for another fund. I think that it will worsen the situation. This fragmentation is not what we want. We like the fund. We like the way it is governed. We like the efforts that were put to create a solid and sustainable, I would say, governance system. We like that. We are there, and we are continuing to be working with the fund. I think that that is also a good and very important message that we want to convey to not only to the civil society, also to ourselves in terms of commitment towards the future. I said before that there were these, because Vice Minister Padilla mentioned, and I would like to highlight it again, this idea of technology being transferred from the south to the north. And I think that that's extremely important. And I hope that the agreement, whatever the result is, will also contribute to that. But I would like to mention very briefly that we have this global gateway strategies, investment infrastructure in the south. I think that infrastructure now, we have to look into infrastructure with a different perspective. It's not just bridges and ports. Nature is infrastructure. Health is infrastructure. And we have invested 1.2 billion in local manufacturing of vaccines, medicines, and health technologies in Africa. And I would like to insist on that. 3 Team Europe initiatives. Global Gateway is good, not only because it's smart investing, it's also a Team Europe experience. So it's the European Union plus member states. And I would like to underline this, plus the private sector. The American and the US government has PGI. We have Global Gateway, and we are talking to each other, trying to do things together, like the Lobito Corridor initiative in Africa. But I would like to mention 3 initiatives, and I will stop there. The first one, to support public health institutes in Africa. We want knowledge in Africa. That is a 50 million euro investment, and there are many countries there. Spain is one of them. The second will be the digital health initiative. We need not only technology, we need also data, and we need the systems to be able to do that. This is an 87 investment. There are many countries, many European Union member states, including Spain also, and I salute that. And the third one is the social protection initiative to strengthen precisely the national social protection systems also in Africa. This is 250 million. So these are real specific initiatives, and I think that the goal we are all pursuing here is precisely that, to help Africa to be able, down the road, to send to us what we were trying to send to them in not a very efficient way, I have to say, but the political will is there to try to correct that trend. Thank you.
Thank you very much, Javier. Firo, we move to you and the vision of PAHO, the vision of the Americas, if I can be ambitious here in this regard.
Thank you so much. Well, there are many topics that are being discussed at the global level, and also in many of those topics, the countries in the Americas came together. And I believe there are more than 16 joint statements around the specific topics on the pandemic agreement or accord. And that is new because the regional Americas was facing a huge geopolitical challenges for many years, but then when it comes to find solutions to what the countries in the Americas faced during the pandemic, they came together. So the pathogen access and benefit sharing is one of the key topics of the discussions. Still, I think we will see that the member states at the global level will come to a certain level of agreement. Still, many details must be done afterwards because there is no time to discuss all the details, but something must be reached by the World Health Assembly 77 in May. The other topic on equity, I think it is a topic that is commonly understood but also agreed. But equity in terms not necessarily giving everybody the same thing. It is giving the people that need the most what they need in order to save lives, and the countermeasures must be in place. That is the terms of that. It's something that many people may identify differently. The other one is collaboration. Many countries in the Americas, particularly mid-income and low, well, the only lowest income country in the Americas is Haiti. But when we see inside the member states of the Americas, there are huge challenges. So that came to an agreement to have a joint collaboration. For example, the rapid response teams that the countries in the Americas agreed more than 20 years ago began in the Caribbean, because the Caribbean, as you know, small island development states cannot afford, not even reach the core capacities of the IHR by themselves. So they identified that having access to those capacities in other countries may also help them to reach those capacities. And in the Caribbean, the regional, sub-regional for us, response team was established. And I'm talking about this because collaboration is key, both in the diagnostic, in the treatment, in the sharing samples, etc. But I think when we are talking about the amendments on the IHR that is closely related with the INB negotiations, there are certain aspects that must be agreed upon. For example, the definition of pandemics. When we do have more than 50 definitions of pandemics, most of them academic. But then when it comes even legal, that's why one of the reasons why the pandemic was not declared or let's say identified as a pandemic was not easy to do, because there are many laws that consider pandemic as, how can I say, many legislation is considered as act of God. So somebody else must pay that, not necessarily the ones that are providing the means that need the population. And the other aspect, I think it is crucial also to understand that strengthening health systems, that is at the core of the countries in the Americas, it is not the solution. We must look at the strengthening health systems and services in something that may make the difference. Expanding, primary health care will not solve the problems. We need the capacity of early diagnostic, early identification, early treatment, etc. But then it's impossible to have all those capacities at the first level of care. Impossible. So the collaboration that has been strengthened in the America, for example, the emergency medical teams, that is with the big support of Spain, the region in the Americas is the most advanced emergency medical teams initiative in the world, because we look at the country's responsibilities and national EMTs rather than international EMTs. And during the pandemic, more than 400 emergency medical teams were deployed to cope with this solution to the places that were needed most. So that's more or less the approach. And I think in general, the Global Health Emergency Corps is one good avenue on that, because that also strengthens the collaboration. So again, this is an initiative in the Americas, but it is fully linked with the global level, because we cannot have differences at that point, because when a large emergency happens, we need everybody's support. And I think the countries are looking at that every day. Thank you.
Ciro, let me come back to the question that I asked before. Do you perceive that the interests of middle-income regions or middle-income countries are properly represented in this conversation? And thinking about regions that have, for instance, medicines production capacity, but do not have the knowledge to do so. Regions that sometimes are excluded from global development funds because they are not low-income countries or are not the priority in this regard. And we could see that during, for instance, the criticism to the COVAX mechanism at some point during the pandemic. Do you believe that these are properly considered right now?
No, they are not. And this is a big problem for the Americas, particularly because we do have many middle-income countries, but everywhere in the world is not properly addressed. I think that, if we are thinking that putting money in very, very difficult spaces or contexts will make the difference, we will fail. We fail, unfortunately. But if we look at some strengthening certain areas that middle-income countries need in order to reach the level of safety and security, will help us all. Will help us all. And that is something that is not being seen through the lenses of many institutions. For example, they are looking at only least developed countries, or they are looking at low-income countries, and all the middle is left apart. And that is one of the positions of most of the countries in the Americas in the negotiations, that those type of terminology or concepts are not fully addressed. And in the negotiations, we may see that probably will go far less to the countries that the areas that the countries may need, instead of solving the biggest solution of safety and security in the world. Thank you.
Ciro. Elijah, let's close this round with you. Then we will open the conversation to the...
So I think for the pandemic agreement, I mean, we talked a little bit about this earlier, but that the hope was it would be a binding agreement. I think we're now in triple overtime, double overtime in terms of negotiations. And, I mean, I applaud the negotiators because there is a definite commitment and a lot of hard work going into making something happen. Because the alternative to that, no agreement, that would be a tremendous global failure. I don't even know what the messaging is on that. If countries have been working on this for 2+ years and cannot come to consensus after collectively we went through the pandemic and all clearly saw the lessons we need to learn. So I think from a civil society perspective, we have issues with the pieces that have been taken out or watered down, but as Javier and Hillary both said, negotiations are still going on. So we'll see. I think the one thing that needs to be in there is some kind of accountability and some kind of measurable outcomes. I mean, the goal, improving pandemic preparedness, prevention, and response, is a gigantic goal. And ultimately, you reach that goal if you prevent a pandemic. And that's very hard to measure. So what are we asking countries, governments, regions to look at and evaluate themselves on progress in the commitments that they're making? That should be clear and transparent. And I think the other thing I would just, maybe this is personal opinion, maybe I'm speaking on behalf of civil society, no more architecture. Like, we have so much global architecture. We have so many financial intermediary funds that can serve the purpose. We have so many structures already. The system is so fragmented, which actually was part of the problem in COVID. And, we made valiant attempts through COVAX, Act A, and other things to bring all of those fragmented pieces together. But one of the things we found out is that the things that were brought together that already had existing partnership did a lot better in the midst of a crisis than the things that were coming together for the first time during a crisis, which makes complete sense. But so let's not just keep adding more pieces to a puzzle. The jigsaw puzzle is, as big as this room at this point. So I think the accountability, there has to be some kind of agreement. I don't know what happens if there is no agreement, honestly. And I mean, from a civil society perspective, we will keep doing what we do, which is advocating, which is partnering with governments, which is lifting up the voices of marginalized populations. Because that's the other piece of this, is that we're talking about not a homogeneous group of people that are impacted by pandemics. And I know that there is quite a bit about, sharing technology and data and wastewater surveillance and a lot of really cool technologies that everyone needs. But I also just want to, as a public health person, bring us back to the basics. Let's make sure that people have clean water, sanitation, hygiene facilities in health systems in their community, that we have food security so that people, if they do get sick, are healthy enough to battle the virus, and that we have a resilient health workforce, which means supporting the workforce with the correct equipment. It also means compensating them, pay the community health workers. You've got to do that, because otherwise you have brain drain, you lose health workforce, people don't want to be trained. There's too many conflicts there. And so we're talking a lot about technologies and digital this and digital that, but there are some really basic public health principles of preventing disease that we are not meeting as a global community.
Thank you very much, Elisha. So let's open it to the audience and to your questions and comments. The only thing that I would please that you are succinct, okay? But please feel free to make a commentary if you want, and then we will open to your if we can I don't know if there are already Judith here and here. Please introduce yourselves when you. Is there a micro? Here, a micro is coming.
Thank you. Is it working? Yeah. Well, thank you. That was fascinating. I am Judith Garcia-Emerick, and I am a researcher at the Barcelona Institute of Global Health, and I am the head of the Department on Environment and Health, which hosts the research on preparedness, among other research areas. So I have one question about research and then another about health services. This table is about governance, and you have talked a lot about the need of collaboration. But collaboration is not only among countries, it needs to be among the different actors at every country and at all countries. And this includes also researchers. You have barely mentioned researchers. Some of us felt a bit impotent, let's say, during COVID, because we have knowledge, not all the knowledge, obviously, but we have some knowledge and we were not heard, let's say. There were models predicting COVID will hit here in 2 weeks, and the response was, these are mathematical models, right? So it was quite frustrating. So my first question is, what do you think is the role of researchers in this preparedness for new waves? And my second question is a bit different. You have all talked about strengthening health services. My point is that this needs to be extremely flexible, and it's almost impossible to cover for every kind of crisis, even every kind of biological or zoonosis, because COVID required ventilators, for instance, but maybe the next pandemic will not require ventilators, but another resource. So it's whatever we do with health services needs to be flexible and cover for many different possibilities. So how do you approach this? Thank you.
Very well. Let's take another one.
Thanks so much. My name is Maria Fernandez. I am with an organization called Internews. It's an organization that promotes healthy information by working with information providers in more than 100 countries. And we actually work to address misinformation and disinformation as well. So my question, great input so far, so thank you so much. Some of you talked about accountability, and I wanted to go back to the issue of mis and disinformation flourishing the most when good information, or actually information that matters to communities, is not really addressed. We saw a big top-down approach during the pandemic, in some cases incredibly helpful, but in some cases really lacking what people care the most. So how can we bring accountability as a response to mitigating bad information? Thank you.
Very well. Let's take a third one in this round.
Thank you. Congratulations to the panel. I am Soledad Garcia Muñoz, currently the Iranian Chair in Human Rights in Georgetown University, in Georgetown Law. And previously, until August last year, I was the Special Rapporteur for Economic, Social, Cultural, and Environmental Rights of the Inter-American Commission on Human Rights. And my point is to listen from the panel about what space and what is the kind of measures that you are taking with this a specific perspective of human rights, because I think human rights would be central, not only human rights to health, but also water, sanitation, etc. And I am really interested to listen from you about that. Thank you.
Very well. Okay, so collaboration and the role of the scientific community and researchers in the PPR debate, health systems and health strengthening, and how to approach this. Also, the question from Maria on mis and disinformation in relation with accountability, which I think is a very critical part of this conversation as well. And Ms. Muñoz also the role of human rights in this regard. Cecilia opened her intervention with something that seems evident, but when you think about it, it's not so evident, which is that we are talking first and foremost about a fundamental human right and how this is going to be reflected in the negotiation. No? Sorry, I should have taken this. Sorry. So I don't know who wants to start and wants. Jim, please go ahead. Yeah.
Gonzalo, thanks very much. And just a brief intervention, then I'm going to drop off and leave the panel and the rest of the event. But Absolutely. Just wanted the colleague there from the Barcelona Institute Global Health on research and development. And come and speak to Jeremy Farrar, our Chief Scientist Officer. I'm sure he'd love to hear your perspective on this as well, because it's in there. It is in the pandemic agreement, recognizing in Article 9 the need for strong partnerships around the world on the science, research and development, trying to make sure that state parties, all parties, drive this agenda forward. We've got to get better. We've got to get more efficient, more effective. We've got to look at what works where, in what context. As Ciro was saying, where's the best dollar of investment that's going to have the greatest impact? How do we put our supply chains appropriately to work? How do we get surveillance to be more efficient, etc.? So science is at the heart of this agreement going forward. And again, Gonzalo, apologies, I'm going to have to drop off, but thank you again to Spain and the invitation for WHO to participate.
Thank you, Jim. Hilary, you want to, yeah?
Yeah, sure. Thank you for the questions. Really great, thoughtful questions that raised aspects that we hadn't perhaps touched yet. So maybe I'll just go in order and address most of the questions. So first on research, thank you for shining a spotlight on research. It's absolutely critical. In my role and in past roles that I've had, I think about this in the context of outbreak response and the need for real-time research and making sure that those networks are built and that they're incorporated when you're thinking about the research that's needed, not just for medical countermeasures, but to better understand the transmission of a new or novel pathogen. One of the things that I would point to is from a past post that I had, but during the 2022 Mpox outbreak, the Office of Science and Technology Policy at the White House released a research agenda that was meant to put out the core research questions to anyone who was working on or could work on Mpox research. And so that's one example of a way in which governments and researchers can work together. And I think, there's more room to grow on that as well. On strengthening health systems, I think maybe I'll pull a couple of examples from PEPFAR, because I think that has a lot of examples to think about and to work through. So first, you heard me say earlier about PEPFAR's impact and reach, particularly on healthcare workers and training healthcare workers as part of that broader health system. Just last year, they trained over 300,000, I think it was nearly 350,000 healthcare workers. And there was I don't know if Jim is still on, I can't tell, but there was a forum with Jim's team that was co-convened called the Africa Health Workforce Investment Forum that was focused on this aspect of it. Another key piece that our PEPFAR team has identified is nurses and the role that they play. And so earlier this year, we announced a nurses leadership initiative that sought to build the technical and leadership capacities of nurses, understanding the role that they play, so they can not only be better prepared to deliver HIV services, but also to sustain the shocks such as what we saw with COVID. And just lastly, on mis and disinformation, this is on our minds quite a bit. I think, I'll give a specific example that happened recently, and I think Elisha's heard me talk about this one before, but it was reported in the Wall Street Journal and then also on the State Department website, where a Russian disinformation campaign talked about outbreaks in Africa and attributed them to the West, essentially. So what the State Department did was put out through our Global Engagement Center as much specificity as we could that this was Russian disinformation, name the campaign, name the individuals, to point out that mis and disinformation is happening, and to flood the system, if possible, with the correct information. So I welcome solutions from this group, because I don't know that there's a silver bullet to countering mis and disinformation, but I think it's more of what they call the Swiss cheese approach. I'll stop there.
Thank you, Hilary. Javier.
Thank you very much. I will start with disinformation and misinformation. In Spanish, we just have one word. It's useful that in English there are two because of the nuance. And the nuance is very simple. The difference between your and just reposting something that she thought was interesting or outrageous or both things at the same time, and someone doing it with malicious intent, and that would be the case here. That's the big difference. We in the European Union are fighting what we call foreign information. No, sorry. And exactly, and manipulation of information, that's malicious intent. That is someone actually trying to hurt. And it is very important to, yeah, there is no silver bullet. But the only, because if you go with all your information and your charts and your very solid narrative, you will not reach out to the persons that you need to reach out. So the only way forward is, and the key issue, as you know very well, is attribution. That's the last line. If you are able to attribute one of these operations to someone, an entity, then you can actually use all the tools to, not to prevent, but to fight against it effectively. About the health systems, I will insist on the need to take into account primary care. I think that Dr. Ugarte mentioned that before, and I was privileged to work with the Pan American Health Organization, and it's a very, very professional organization. I learned a lot. Now, the Ambassador Monton here, who is the permanent representative to PAHO, can attest to that. But I do believe that the key issue here is to keep on working on primary care so that we can reinforce and strengthen the health systems. One last word about the agreement, even if there was no question, I will ask myself, because I think it's important. We need to fight, because it's this information about this perception that this is against sovereignty, and that but at the same time, I think it is paramount, whatever the result, because of course, if you don't move forward, you actually go backwards. And I agree with you. What's the alternative? There is no alternative. But I think that it is very, very important that the credibility of WHO is preserved. So whatever the result, the process, so the thing you suggested before, we don't like the idea. I think we need to protect the process, and we need to protect WHO credibility at the end. So I just leave it at that. Thank you.
Thank you. You want to say, Elisha?
Yeah, I was.
Theo later if you want.
I was just going to say on the disinformation, misinformation. So first of all, there's an information person and a researcher sitting right next to each other. You two should talk to one another. That's one thing. But I think the piece about this is the disinformation is coming from propagandists. It's not coming from public health professionals, right? And so we are, as Javier said, we're trying to counter that with sort of charts and graphs and rational arguments about public health. And so we're losing that battle. I mean, I think the thing to keep in mind too is that the propaganda, the disinformation is fear-based, right? It's not addressing people's public health knowledge. It's not their knowledge of multilateral organizations. It's spreading fear. And so when we come in and we're talking to them about public health statistics and these macro policies and systems, I mean, you just glaze right over. That's not the conversation. And so I think, you know, not that I would suggest veering into not using facts or truth, but I think that there's a real disservice being done for public health professionals in educational systems where you're not trained to communicate, right? You're trained to talk to somebody that you think thinks like you. That's not who you're talking to now. You're talking to somebody completely different who doesn't know anything about public health and wants to be reassured that public health is the way to make their life better and keep them safe. But that's not the information we're giving to counter the fear mongering.
Elisha, you want to say something about the human rights question?
Yes, I do. So it's a problem. I'll say that. I mean, we have all of these UN documents: human right to health, right to water, right to be healthy, freedom from violence, freedom from infectious disease. Those are UN documents, and we have some at WHO. WHO is a part of the UN system, but how those all talk to each other is a different story. I'd also say that the tools that are used currently, and sorry, I don't remember what the acronyms stand for, but the SPAR and the JEE, which are the kind of pandemic preparedness and response measurement tools, they're not human rights focused at all. And so there definitely is a need to lay on some additional measurements around human rights in those tools, particularly if those are the tools, and I'm assuming they are, that countries will rely on after the agreement to kind of track their progress on preparedness and response. And those right now are very heavy government-centered created tools. So there's also a real need for civil society and communities to start making partnerships with national governments to improve how that information is collected.
Thank you. Tito, you want to add something, please?
Yes, thank you so much. And let me begin with the primary healthcare approach. I truly believe that primary healthcare approach is the one that will help everybody. But there is a problem with the word primary. When we say primary, it means in many Spanish-speaking countries, the first level of care. And that's not the point. Primary is the most important care, is the chief importance. So it is the approach, and primary health care can be done and must be done even at the tertiary level of care. It is the moment that the patient, the person, approaches the health system, and they may receive everything, the primary care that they need. That is the approach. But if we are thinking about the first level of care, come on, we will not solve the problem. That's my approach, okay? At the same time, I think that when we talk about research, it is not research on the perspective of creating new knowledge in order to serve the world in general. It's of utmost importance. But during pandemics, the research must be related with this solution that we must find. And there is the collaboration that we were talking about. And the pandemic accord, as Jim mentioned, research is a network of collaborating centers of many partners. At the same time, there are several issues about in intellectual properties. You know, most of the research is done with the data and information that is, and the samples that is provided by the healthcare system and the countries and the nationals. So where that research will go? And then if there is a economic, benefit on that, how that benefit may be shared with the others. That's also the core of the pathogen access and benefit sharing. And the other one is, how can we be sure that in the next pandemic, we will still need some respirators or others? I think the adaptation of health systems and services must be done in a way that there is a proper risk assessment. We must strengthen those aspects where in places and networks that we ensure that the new pathogen or new emergency can be coped at any level. But in general, we must also learn during the emergency. That is how it happens. So in more large emergencies, we learn during the process. So that's the part of the planning and strengthening. Not only strategic prevention, preparedness plans work. The plans work when they become operational. And the component of operational plans are missing big time in many of our approaches to the countries. And coordination, you may have heard from me sometime, coordination is a nice word. Everybody wants to coordinate, but nobody wants to be coordinated. So in that regard, it is an issue that unfortunately is happening on the visibility of the institutions. Okay, somebody represents the institution, so they feel that they must coordinate. But then when somebody else, maybe peers, are alone, there is a difficulty there. And it comes also collaboration. And that is the core of things. And let me finish with some of my previous words on the people at the center. People at the center. The human rights must be respected, not during pandemic only, today. Today, when the people approach the health systems and services, their rights must be respected. And then when those rights are respected in normal times, it is just logic that in large emergencies, those will be respected. But if that is not happening now, probably in large emergencies where there are many interests and many challenges, those rights may not be respected at the level that we want. Thank you.
Thank you very much, Ciro. I think that we are going to finish with that because we are on time. I thought it was interesting that this round of questions raised I don't know if it was on purpose, the kind of very practical obstacles that we are facing in this conversation about governance. No, it was our experience during COVID that researchers for the first time understood that they had a responsibility of translation and a responsibility of engaging with the society, and they saw that they wanted to do that, and it was a two-way process of learning in this regard. And I think that we are here in a campaign in the United States where one of the candidates has written a book against Dr. Fauci. I think that another of the candidates does not have a better opinion about Fauci himself. We saw what misinformation means in a subcontinent like Brazil during the COVID pandemic. We saw that in practice. We are seeing how human rights are being forgotten very often in the negotiations, and we are coming back to the old conversation about profits versus people in this regard. So I think this all comes back to the very obstacles that we have during these negotiations. Huh? But I think that we had a really great conversation, and I'm really thankful to you, Javier, Hilary, Elisha, Ciro, Jim, that I think that had to leave us before. I'm really grateful for your commentaries here, and I try to push you a little bit in this, but I hope that you enjoyed the conversation like me. We now have a break of 30 minutes, maybe, and a coffee there. Maybe we can start a little bit earlier than 12 with the second panel. I don't know if that is possible for the sake of your time, so you have a little bit more time. But in any case, I mean, we will be joining you in a few minutes. Thank you very much. Thank you.
So now after the break, we are ready for the second panel. We are talking about the financing. So now, please, you have the floor. Thank you so much for being here.
Thank you, Eva, and thank you all very much for staying. I promise that we'll have a very entertaining discussion, and I promise that at the end of the day, it's all about the money, right? So we will have a lot to talk about here. So first of all, let me introduce the very esteemed panel that is here with me. So I'm here with two of our panelists, and two other panelists are joining virtually. So here on my left, we've got Priya Basu, who is the head of the Pandemic Fund Secretariat at the World Bank. You have heard a lot about the Pandemic Fund, and if we think about progress, the first institution or the first words that come to mind are the Pandemic Fund. So we'll hear more about that success. Now we also have Nidhi Buri, who is the Deputy Assistant Administrator at USAID. We also heard about the new global health strategy and how USAID is instrumental in increasing the bilateral aid and increasing the number of countries to get to the 100 that the G7 promised. So we'll also hear more about that, where the money will come from. And then we have two panelists joining remotely. We have Fernando Jimenez Ontiveros, who is the Director, Horizontal and Financial Cooperation. So you see, when we translate things from Spanish to English, it sounds a bit weird. So I don't know what horizontal means, but we will ask him.
No. Yeah, I thought we were going to be very lazy, but it's not. It's multilateral, horizontal, as in sectorial, and financial cooperation. Thank you.
Okay, well, it's even more complicated than what I thought. So that is, he is from the Spanish Agency of International Development. So thank you very much for joining us. And last but not least, we have Pablo Ibarraran, who is the Chief of the Social Protection and Health Division at the Inter-American Development Bank. So thank you very much for being with us today. And the first thing to say is, you know, in 2020, when we were, facing the pandemic, a lot of work was commissioned to try to understand how much money is needed for pandemic preparedness and response. How can we finance this pandemic preparedness and response better? And there were very seminal, interesting reports, all talking about billions of dollars. And people thought, oh, that's a lot of money. But then people quickly realized that it was a small investment in comparison to the trillions of dollars that the economy, the global economy had basically lost because of the pandemic. So 2020, I guess the figure was, one of the figures was $10.5 billion every year for 5 years. That was the amount that was estimated to be needed for external financing for pandemic preparedness and response. 10.5 billion per year over 5 years. Now, if we look at 4 years later, how much money do we have on the table? Then we will ask Priya to tell us a bit more about the numbers behind the pandemic fund. But beyond that, I think it's a question mark. The only thing that is clear is we're not at the 10.5 billion per year at all. And there are certain elements that were not considered in that estimation that are very important nowadays when money is scarce. One, WHO and a more sustainable model to get their finances. Two, vertical global health initiatives, replenishments from Gavi, GFF, and others, which you could claim do contribute, PEPFAR, of course, which you could claim do contribute to some extent to finance pandemic preparedness and response. But also, I guess, it was clear that we need to talk about certain dichotomies. On one hand, external financing, on the other hand, domestic financing. On one hand, vertical financing, on the other hand, horizontal or diagonal financing. So it was not just about how much, but it was also about the mechanism by which the money would be given. The bottom line, I guess, to get started is the money is not there. And we are in the middle of a very difficult macroeconomic outlook. So the money is tighter and tighter, not just in terms of ODA, but also in terms of domestic financing, where a lot of countries are under a lot of debt distress, and a lot of countries are not growing. And the conversation clearly has moved beyond pandemic preparedness as a priority. So how do we think about where we are? How do we think about the future of pandemic preparedness financing? So with that, my first question to the panel is about the US and the EU. So can we hear a bit about what the role of the European Union and the role of the US has been and will be in financing pandemic preparedness and response? What can we say about that? Priya, do you want to get us started, please?
Sure, thank you very much. And first of all, many thanks to the Embassy of Spain and many thanks to ISG and CGD for hosting this event. It's been a great morning and it's been really encouraging to hear several shout outs to the pandemic fund, but also, there's a lot of expectation on the pandemic fund to deliver. So, I just want to share a little bit about what we've done. Our ambitions are high. Looking at Lily here, and I'm looking at our colleagues from the European Union, and I'm looking at the Spanish Agency for Development Cooperation. Thank you very much, all of you, for your generous support to the pandemic fund. COVID-19 really laid bare, as you were saying, the chronic underinvestments in this agenda in in investing for pandemic prevention, preparedness, and response. And in fact, there was a very seminal study anchored at the CGD, the high-level independent panel, a G20 study that said, that came up with similar numbers as we did. The World Bank and the WHO did a study for the G20, and all these numbers converged around the need for about $10.5 billion per year in the next 5 years for international financing. And that's just the international financing piece, complemented by more than twice as much in terms of domestic financing. But I have to say that the international community, did come together very quickly, and it came together very impressively to put together the pandemic fund. It was established in record speed with seed capital of $2 billion, which, $2 billion US in seed capital, which actually is quite unusual. None of the other funds that we host have managed to raise so much money so quickly. That was, it's been called a bright spot in the last few years for the international community to come together so quickly. It was really, we've seen multilateralism at work. We're hopeful that we will be able to raise more resources. We're actually moving towards a pledging moment in October this year. On October 31st, the Brazil G20 presidency is hosting a pledging moment at which we're working towards doubling our resource base. It's also been very encouraging to see various of our donors, put forward very ambitious strategies. The US, for example, and Hillary mentioned it this morning in the panel, about the launch of the new global health security strategy by the US, with the particular pillar that focuses on financing. And 18 months since the pandemic fund was established, it's not been time enough to build a track record. But what I can share is that the projects that we financed through our first round are not only bringing together different partners around national and regional needs, so really fostering collaboration, coordination, coherence in funding streams to meet national and regional needs, but the pandemic fund has also played a very catalytic role. For every dollar of grant financing that we awarded, we've managed to mobilize $6 in additional financing. Of those $6, 4.8 comes from international and 1.2 comes from domestic. So we are seeing that countries themselves, low and middle income countries themselves, are also putting in their own resources. And while, in some places, there are, conversations around pandemic amnesia and the fact that, people have already moved on to the next issue. What we're seeing from developing countries applying to the pandemic fund for grants, we're seeing they haven't forgotten, and that there's tremendous demand to invest more in pandemic prevention, preparedness, and response. And that demand, our first round of proposals was, our first call for proposals was 8 times oversubscribed. We had 133 countries applying, and it wasn't just grant money that they were asking for, they were also putting in their own money into this. They were saying, we're committed, we don't want to see, another COVID-like pandemic where we're unprepared. We want to protect people from the next pandemic. So, I'm optimistic. I have more to say on this, but I'll stop here for the moment and, maybe come back later. Thanks.
Thank you, Priya. So I guess Priya is already hinting to the US colleagues and the European Union colleagues that there will be pledges later in the year, and the expectation is very high. So we'll get to talk about the expectations versus what the donors are thinking and the macroeconomic outlook. Nidhi, do you want to give us your perspective? I mean, where does the US see it in terms of financing? And I know we've heard how the US was instrumental in creating the pandemic fund, but we see 2 billion is the number that Priya gave us, and we also heard the 10.5 billion. So there's still a big discrepancy, and there's still a lot of underfunding. So what is the US take on this?
Thank you. And thank you again to the organizers for having all of us. I'll comment on a couple things in terms of the US government's approach, our role at USAID, and then I do want to build on some of Priya's points around the pandemic fund specifically. So I think first, one of the silver linings in COVID was that I think it forced a needed conversation to re-examine the way we invest in pandemic preparedness and response. And it really highlighted the need to both invest on the side of prevention, but then having tools that could quickly get mobilized to support response. And it put a spotlight, therefore, on kind of the holistic nature of financing, but getting at exactly what you said, which is that investments in preparedness and prevention are significantly more cost-effective than dealing with response. For the US government, and USAID plays a really instrumental role in this, we have invested in health security, which essentially is what we term the investments in pandemic preparedness, prevention, and response for decades. And we've done that in two ways, through bilateral investments at the country level, and then through multilateral investments, and in more recent years, also kind of branching out into a third category, being regional investments. USAID in the last 10 years has invested $1.6 billion to countries across the world, looking at how we can support countries achieve targets in their national action plans for health security, and looking at their ability to scale and invest in the adequate technical capacity. And that's done in partnership with our colleagues at the US CDC and other agencies as well. But I would note that those investments couple and kind of are part of a broader set of investments that we at USAID have made in health and economic systems at large. And I note that because I think what we have seen is that investments in basic services and primary healthcare are just the other side of the same coin of health security. We need to support countries in being able to have resilient health systems to minimize trade-offs that inherently happen during COVID and do happen in health emergencies. And that collectively is an investment, not just in our common security, but specifically in our economic security, when you look at the cost and the cost savings when you ensure that communities are healthier. In terms of on the multilateral side and the kind of more the different tools that we've seen for health financing. What we have done is looked at how to guide the investments we make at the bilateral level in consideration of the multilateral investments we make. And what I mean by that is when it comes to entities like the Pandemic Fund, which, as you noted, the US government has been a huge proponent of since the very beginning, we have seen it as investments as not an either or, but a both and. The fact that we need to maintain country level investments while also maintaining and scaling up investments at a global scale. And the purpose of that is because these different financing tools are in fact tools. They're tools for countries to kind of pull different levels to support both preparedness and ultimately response activities if and when the time is needed. For our investments looking specifically at financing going forward, I think there are really three areas that I would touch on that are critical for us. So one is continued investment and support in the Pandemic Fund. As Priya noted, the fund is inherently designed to be catalytic to unlock resources, and we see that as pretty instrumental and as additive to the financing tools that are on the table for countries. So it plays a unique role in that standpoint because the fund essentially is giving countries a lever that did not exist before that they could unlock to support these investments in prevention and response. Those types of investments, I hope, in what will be an election year for the US as well, should not be political. We should see investments in health security as investments in our collective security, and independent of a numerous range of countries that will be potentially in states of political transition. My hope is that those investments continue and are seen as central to supporting communities and ultimately countries in advance their health security objectives. The second area that we've seen as pretty instrumental, and this links to my point about health security being looked at in a holistic way of investments in health systems, is at USAID, we've seen a pretty vital role for the global financing facility at the housed in the World Bank, where what we've looked at is investments in primary healthcare as pretty central to supporting communities and ultimately systems in their readiness and their ability to prevent, respond, and of course, throughout all of that, detect different types types of infectious disease threats. And the third, I'd say, is really looking at the instrumental role that the private sector has in both financing, in the sense of putting forth resources to, especially as we mobilize resources in advance of the pledging moment for the pandemic fund, but also looking at investments in the concrete tools that they bring to the table, really in the research and development space, in supporting pandemic preparedness and response. So in that way, private sector entities can both support direct financing of efforts, but their investment in tools ultimately is a cost-saving measure as well. And our focus at USAID is really on, once tools are available, getting them to scale and scale to use some kind of last mile delivery. But that ultimately is also cost saving, because if we can detect threats earlier and address them and treat people when they're affected, that minimizes the economic burden on countries as well.
Thank you, Neri. Let's go to Fernando. And we've heard about you used a different word, Priya, you said a pledging moment, which is a kind of like a synonym of replenishment, I would say. So we have the pledging moment of the pandemic fund later in the year. We also have Gavi 6.0, so we have the next strategic period for Gavi. We have the WHO also going down the path of having replenishments. Fernando, can you tell us, where do you see, the funding, or how do you see the funding going to support all these replenishments? Do we have a replenishment traffic jam, or is the European Union or the donors ready to step up to all these important needs, but still difficult to meet? Over to you, Fernando, and thank you.
Yeah, thank you very much. And sorry I couldn't join you in person. I want to first to praise really my good friend Priya for the effectiveness of the pandemic fund, which is amazing, and the flexibility also as well. Let me start by saying, for a country as Spain, global health is a top priority. As you have, I think it has already been discussed, we are the Spanish government is in the process of setting up a strategy, an international strategy for global health. And actually, our president committed last year in the General Assembly of allocating 237 million euros in the next 3 years. Just to give you a sense, not to inundate you with figures, but we do collaborate a lot. It has meant 48% of our multilateral cooperation of the agency that dedicated to global health and to different vertical funds and organizations as well. So and definitely we want to increase our contribution to the pandemic fund, as well as to other global health mechanisms. But I want to stress, I think, some of the underlying questions and provocative questions that you're raising. I think, first of all, I think it is absolutely urgent to sign as soon as possible the WHO pandemic agreement, and to establish in that context, I believe, a financial framework that is adjusted to the possibilities of all countries. I think in this regard, the next 77th World Health Assembly, the last week of May, will be essential to get a sense of whether the negotiations and coordination are bearing fruit, and we can expect agreement in the coming months. I think it's also important, the governance. I think it's very important that the pandemic agreement includes representatives not only of all countries, but also from civil society of the global south, and also balancing the roles and responsibilities of every country. So while we really favor and prioritize the pandemic fund and the preparedness and response to pandemics, clearly, and we agree that there is a tremendous financing need. I think one of the lessons is that together with this funding, as I think you suggest, Guzman, an improvement of collaboration and coordination is equally critical. I believe there is indeed this traffic jam. On top of the pandemic fund and many other global initiatives are funding preparedness and response to pandemics. And I think one of the lessons of the COVID was precisely that this proliferation of funding sources, as well intended as it is, clearly could exceed sometimes and collapse the absorption capacity of the beneficiary governments. So does the excessive fragmentation of this international health development. Therefore, and perhaps this is a little strong statement from us, we consider that the pandemic fund should be at the head of and the only financier of the pandemic agreement. And if it is necessary, deemed necessary, and it has already proven its flexibility, its structure and governance it can be and should be accommodated to the needs of all the signatory parties that, of course, have to be represented in the governance. Another key element is that to incorporate innovating, I believe, financing sources. As you know, Spain has contributed, has made a great effort for a small country in contributions both to Gavi and CEPI. But we believe, for instance, that the international financial facility for immunization, we say IFIM in Spain. I don't know if you say IFFIM. I think it's a critical and a very important instrument that has proven an effective mechanism. So, as a summary, I stop there. Spain considers that it is necessary that all signatory partners of the agreement contribute to financing through effective financing mechanisms, and we need, therefore, the agreement to be signed the sooner the better, and probably have the flexibility to give up some of the red lines in order to help prevent the new pandemic. We know that the European Union and its member states are the main funder for the pandemic fund, with almost half of the current pledges, and we are definitely committed to pursue this and work with our European partners to make the necessary adjustments in order to reach such agreements in time for the next World Health Assembly. Thank you.
Thank you, Fernando. You make the link between the pandemic negotiations and the pandemic fund, which I think is a very important link to make as a mechanism to finance pandemic preparedness and response. Saying so because I'm sure our audience knew that there were conversations about creating additional mechanisms. So I guess what you're saying, which is something that I've also heard and I agree, is let's stick with what's been created and seems to work. And let's fund it properly. Now, Pablo, exactly. we heard from Priya that countries are interested, that there is a catalytic role, $1, $6 for every dollar invested. And the Inter-American Development Bank is one of the implementing entities. So you're closer to the countries and you've seen how that works. Can you tell us a bit about how you make the case to countries for investing into pandemic preparedness and response? How does this work? I understand what Priya was saying about the pandemic fund and how countries are really, putting proposals together. But at the same time, I see the IMF's Resilience and Sustainability Trust that was created to fund climate and pandemic preparedness solutions, and no country has actually included pandemic preparedness in any RST proposal. So can you give us a bit of the perspective of a multilateral development bank that is closer to countries and is in this intersection between all these instruments? Over to you.
Thank you very much, Javier, and thank you very much for the organizers for inviting us. I really apologize for not being there. I have a meeting just after this one, so I was not able to make it in person. I think there are several aspects to consider here in terms of how to mobilize resources from the countries. I think they really appreciate the possibility of accessing the pandemic fund, but there is also greater need to create conscience in terms of the domestic financing that is required, right? There's a lot of figures going around. You mentioned the 10.5 billion, I think from the high level panel report before the pandemic fund. And the point is, in Latin America, in the first case, there were many proposals. And of course, as Priya mentioned, it was oversubscribed, I guess, by a factor of 8 or 9. So there was kind of disappointment from countries. And I think we still need to make the case. And I think Rachel Glenister's work on what are the costs and benefits of the expected cost of a pandemic and how much any investment really is very good investment in that sense. To really work with the ministers of finance, we need to understand that the fiscal situation now is very complex. In Latin America, the debt to GDP ratio increased during the pandemic, understandably, but there needs to be some fiscal restraint. So I'm really having a hard time from the bank mobilizing the interest from the ministers of finance to really support new projects, right? I think we have been successful and we have worked with some countries in the first call for proposals. We're working, and I know our colleagues from the World Bank are working as well in several Latin American countries to mobilize these resources. But countries need to understand, and Latin America, as it was mentioned in the previous panel, is like in the middle, right? In the terms that we were very hard hit by the pandemic. We need, as Ciro Ugarte mentioned, we need to learn what went wrong. And I think the work that the G20 is doing in terms of having a playbook and learning the lessons in order of how to respond is very important. But resources, as you mentioned in this opening today, Javier, the money is the important part here, right? So I think we still need to develop tools to mobilize more money. And here I just want to mention very briefly, I think that we still need to have some dedicated financing to really work with countries on a pandemic preparedness plan where you can have the idea, I mean, we have the idea of doing JEEs and then the Global Health Security Assessment Plan. And from there, you have an investment plan that will guide how resources from the pandemic fund or from the countries or from other sources could add to this plan. But in many cases, that plan is not well developed. It's not like a really an investment plan as we need. And I think that is something important because when we're arguing for investments, we need to be able to show how these investments will reduce the impact of a pandemic or the likelihood of a pandemic, or will make the response better and the pandemic or the health emergency less likely. So in order to get more resources, we need to make the investment case. But going not from the very big figures that we all know and share, but going to the country level and the regional level to really say we need to do some investments and countries need to put the resources. The idea of the pandemic fund, I think it's to be catalytic, and we need to mobilize those resources and for countries to put it on top of their list in terms of priorities for the coming years. Thank you.
Thank you, Pablo. So I'll get back to you, Priya. I don't know if this is actually already decided, but how big is the pledging that the pandemic fund is getting to, and how are you making the case for it? I think in these very difficult times where health expenditure is plateauing, ODA is also challenging. So how much and how are you making the case? Over to you.
Thank you. So actually what we're working on is a two-track resource mobilization effort where there's a long-term effort to raise a more sustainable financing to put the pandemic fund on a sustainable financing path, and we're exploring innovative options. We're looking at ways to attract new donors. Right now we have 27, of which 24 are sovereigns and 3 are philanthropies. We want to grow our philanthropic base. We want to have more donors from, we have quite a few low and middle income countries who are also part of our donor group. For example, we have India, South Africa, We have Indonesia, also have China. So we want to grow, that base beyond the G7, G20. So we're working on all of that. But in the meantime, we have this short-term need. And that's why we're calling it a pledging moment, which we'll have in October. And the way we're calculating is, and this is based on the analysis that we did in 2022, but we've updated it because, that needs and gap analysis, some of the needs have been, are being filled through new mechanisms that are being set up. For example, the work that Gavi is doing on Africa vaccines. There's, other initiatives, but there are some areas that are still, that we are zooming in on, in particular, early warning surveillance, laboratories, and health workforce. And they're working backwards, for the needs that we've estimated on an annual basis, and assuming that we can maintain our leverage ratio, because we have achieved this 1:6. And I do want to emphasize that, because when we look at, gaps and so on, it's not just the seed capital that the pandemic fund has, and it's not just what we award, but it's what we mobilize through what we award, right? So working backwards, we feel that if we're able to allocate $1 billion per year over the next 2 years, through that leverage, about $6 billion per year additional, then we can meet those international financing needs in the areas of early warning surveillance, labs, and health workforce, with cross-cutting themes being strengthening national public health institutes and building regional networks. And then, of course, I should have mentioned that, there are some strong areas of focus of the pandemic fund across everything that we do, which is, putting communities at the center of what we do, bringing in civil society voice, taking One Health approaches. The projects that we've supported through our first round, even though we didn't necessarily ask for this, we're seeing an overwhelming emphasis on bringing together different arms of government, ministries of health, finance, agriculture, environment, animal husbandry, coming together around, investments that really recognize that human health, animal health, and the environment are inextricably linked. So, and then also, one of the other things we found through our first round, and we've just finished an analysis of all the projects that we've supported through the first round, most of which, by the way, are now in implementation phase. 95% of them focused on antimicrobial resistance as well, even though we didn't explicitly ask for this. So again, I want to say that, what we're seeing in terms of the proposals that we're receiving from governments, they're really well thought out. There's been a lot of work that's gone into these proposals, where governments are able to put in resources. They're trying their best. In Yemen, for example, we just launched our Yemen project. They've got an idea to use a part of their livestock revenues and put that into a new sort of agency that will do monitoring of zoonotic diseases, which is part of the project proposal. In India, in Ethiopia, in Bhutan, in many countries, we're seeing, efforts to put in more money. Our multi-country proposals, so our projects invest in countries, but also across countries. So we have, we have a project for Latin America, which includes 7 countries in the Amazon basin. It's called Protect. There's a massive, investments coming in from each of the 7 countries in terms of their own investments. So again, now you asked, what is the investment case? I think the investment case is plain and clear. It is that, we have all seen what the cost of being unprepared is. For $10.5 billion of international investment per year over the next 5 years, coupled with about twice as much in domestic investments, you can, protect the world from the trillions of dollars of lost GDP, not to mention the millions of lives, right? And the other point is that this really is a question of, no matter where that investment is made, it's going to benefit everyone everywhere. It's a classic global public good. So you know, that the case is before us. The case is, it's not just, you know, it's been amplified by what we saw happen in COVID-19, but we saw it in avian influenza, SARS, MERS, Ebola. Each time there was panic and then there was neglect. There was panic again, neglect. So what we're saying here is, let's make those investments once and for all so that we break that cycle of panic and neglect. And, you know, those investments have to be made by all countries everywhere to protect people around the world from the next threat. And just maybe one more point, which is that the risks of the next pandemic happening are just getting exacerbated by climate change, by wars, by conflict, by migration, by food insecurity, by water shortages. So there are all kinds of analysis, and the latest one I saw was, it was updated, that there's more than a 60% chance of another COVID-like pandemic hitting us in the next 25 years, you know. Was that you? Yeah, okay, that was you. So, you know, I mean, let's so let's keep that, you know, front and center, and let's do what it takes to make those investments. And it requires everyone to pitch in. You know, it requires the international community, but it requires lasting commitment from low and middle income countries as well. It requires political will, and it requires, you know, fast action.
Thank you, Priya. Nidhi, you mentioned a number when you did your initial introduction, 1.6 billion. Is USAID tracking investments in pandemic preparedness and response? How do you make the case internally to invest in pandemic preparedness and response? Because you also have, of course, all these different priorities and needs. How do you do that?
No, thanks for that question. So the 1.6 billion that USAID has invested is specifically in activities that we'd categorize as pandemic preparedness and response related. So investments in the health workforce and laboratories, for example, in surveillance capacity, in zoonotic disease prevention and response, addressing issues such as AMR, things like that. There are a couple ways that we both determine what to invest in, but then also how we make the case for investment. So one is to really play to USAID's strengths, which is as a development agency looking holistically at the way that health security is really integrated as part of public health in countries, but really cross-sectoral. So as an agency, we also have significant investments in agriculture to address food security and livelihoods, for example, which provides us an opportunity to look really central at what are issues facing communities, some of which might be health, some of which might be other, and looking at how we can really support countries in responding to their priority needs. But the second is then looking at what USAID might be better positioned compared to other parts of the US government. And one effort that we've really accelerated in the last years is our coordination with the US Centers for Disease Control and Prevention, who also play a really critical role in supporting countries in national investments for health security. And while CDC focuses more on laboratory infrastructure and data and science, we have complementary but some other focus areas. So we really look at a country by country basis in terms of what types of activities make sense for USAID to support. And a lot of that is geared and centered in supporting countries achieve national plans. I think one thing that I'd focus on, and this plays off some of the comments made already, is that it is critical, of course, for countries to have some ownership, not just in the strategy and plans, but in financing, achieving those. But for some countries, that will take a long time for a range of reasons. The fact that there are so many LMICs that have put in some money is an indication of political commitment. So I would focus more on the act of them actually contributing to their own health security and the collective global health security, rather than the percentage of how much they're putting in. Because what we need for every country, including high-income countries, is a combination of sustainable domestic financing with an opportunity and mechanisms to support investments that are essentially gap filling. And what we see is domestic financing commitments effectively are part of health systems reform, right? So you do need political leadership. You do need a financial kind of plan for how to actually increasing or rebalance your health expenditure. But that is not a one-year process for a lot of countries. So if we were to say we should focus on prioritizing countries that have demonstrated a certain aspect of health expenditure, we actually would be marginalizing and leaving a lot of countries out. Instead, I think what we need to look at is where is it that these tools that are catalytic, such as the pandemic fund, can really help close immediate gaps while in parallel support countries on their domestic financing plans, which I do think is what's happening, is we're looking at kind of that pairing of support for effectively reforms for sustainable financing, and then ensuring that investments that come through these tools play that kind of more immediate gap filling purpose, or can accelerate investments in areas that might not be so focused on. The last thing I'll say is I think there's a category of countries that we could collectively pay more attention to how we engage with, and that is specifically middle income countries, who I think are in a unique position, many of whom actually have demonstrated lessons that they can share with other countries of how they've actually gone through this process of health financing reform, but also how they've maintained and accelerated a targeted focus on pandemic preparedness and response, having learned from COVID more recently, but of course from learning from kind of other outbreak threats as well. And that allows, I think, an opportunity for countries that are more in the LMIC category to see a pathway towards more sustainable financing, where you can look at the coupling of these investments in terms of donor resources that might come in from the outside, but then with having national plans that have sustained financing.
Niri, a quick question. I mean, we heard that the US, as part of the global health security strategy, will increase the number of countries from 26 to 50. Is there a dollar number associated with that, or a pledge associated with that, or is it the same money?
So it's a little bit of, so actually I think we will hit 51 countries. We will exceed our 50 country target. So the way that we have determined that financing is essentially looking at US government resources, of which we're grateful to the US Congress in terms of what we are appropriated, and then determining how to use that money. But that is essentially for the US government investment in those 51 countries. In addition, we do look to unlock and kind of galvanize additional donor support, supporting those countries so that they can go further. So our goal is really looking at where US government investments, and that's the total dollar amount effectively is looking at what we get in our appropriation cycle. So then we make this decision of how to spread that money across the 51 countries. But what we have as an effort is to look at that, where the US government can go deeper with our investment. And in addition, where can we support additional resources coming in that help get countries to the finish line faster in achieving their health security goals and targets. We have a focus of looking at supporting countries get to what we call demonstrated capacity, which is on the scoring of 1 to 5, 5 kind of being the most ready across a range of technical areas, what that evaluation looks like. That scoring is done through looking at things like the joint external evaluation, the SPAR, kind of demonstrated tools that we have that can give us some metrics that guide how we use those investments. But our goal would be, and our approach right now, is that the investment that the US government makes is not dependent on if other donors come to the table for bilateral investments. We just work to push other donors to support that. And I will say that we use, especially with this, I know Hillary talked about it this morning, the recently launched Global Health Security Strategy is a way to guide the US government's investments, but that does allow the US government to also look at how we support other tools like the Pandemic Fund and multilateral tools as being additional resources that come in to support countries.
Okay, thank you for that. Maybe I'll just open the floor to the public. If you have any questions, comments, suggestions, please raise your hand. Got one here.
Hi. I'm Nurit Eisenman. I've been covering global health for National Public Radio for the last decade. I'm actually transitioning out, so this is more of an independent question. But I was curious, with the Pandemic Fund, as you mentioned, it's been oversubscribed. What was the criteria that you ended up using, or some of the criteria, in terms of how you had to choose, obviously, you know? And then the other question I have is whether you've noticed any trends in, you know, one thing, for example, in my coverage, I've covered a change in thinking, to cite one example, on when it comes to surveillance and looking for pathogens that have pandemic potential. before there was a view, okay, you look at the bat reservoir and you sequence, all kinds of coronaviruses. Now more and more a shift towards looking at spillovers in humans, and look at that as the source. And just wondering whether you're noticing any trends in all of these applications to the fund in sort of strategies that seem to be cutting across countries, like different shifts in what people think are the right ways to do it.
Maybe we take a few questions and then we get the answers. Yes, please.
Thank you. So one of the problems of the previous pandemic of COVID was that the funding that was needed to solve that acute problem was taken from chronic diseases. And actually there is nice work shown done from WHO showing how taking care of COVID actually increased the mortality due to heart attack or reduced screening programs and therefore more mortality related to cancer, poor control of chronic diseases with more exacerbations of arthritis, these kind of things. So how do we prevent this from happening in the future? That the money in solving acute situations related to infectious disease is not taken from the care of chronic diseases.
So one of the figures that was published during the recent spring meetings is that back in 2022, debt service outstripped total aid levels by the tens of millions. And this is not something that is going to get better in the near future, no? And this talks about the competing demands. And this is not just happening with countries, with recipient countries, but what we are seeing, the increase in defense spending in Europe, in countries that traditionally had been focusing on. So my two questions are, what do you expect from the Financing for Development Summit in Spain next year? And what would be your recommendation and to Fernando, what the Spanish government might be planning in that regard for the summit? And then what can we expect from other potentially big donors such as G20 members, China, India, Brazil, the improbable partners in this regard? I mean, how could they step up to the responsibility in this regard? No?
Thank you for the questions. Now let's start with the pandemic fund, if you don't mind, Priya.
Sure. So the question, excellent questions, by the way. So on the criteria for selection of projects, the Pandemic Fund has an independent technical advisory panel, which is chaired by the WHO actually, and co-chaired by the executive director of the Caribbean Public Health Agency. And so the way we work is that the Secretariat does the first level of screening, but sends these projects to the technical advisory panel, which is comprised of 21 world-class experts that was selected through an open competitive process. In fact, even there we had like 300 applications. Everything we do, we get oversubscribed. But anyway, those experts sit on the panel and they review the proposals based on agreed criteria. Those criteria and the scoring methodology, it's all published. It's on our website. So, have a look. So that's the way the evaluation is done, based on various things. And it's based on really the key principles that the Pandemic Fund is trying to achieve again. So looking at, how much domestic sort of commitment there is there, what's the sustainability of the project, what's the strength of the project design, civil society engagement, community engagement, is it bringing together partners, is it, playing a role in sort of collaboration, coordination, is it catalyzing, financing, both external and internal, so, those kinds of criteria. And then so the technical advisory panel makes its recommendations on each project, scores them, but then ultimately it's the board of the Pandemic Fund that makes the final decision, because it wants a balanced portfolio. It wants a portfolio of projects that has geographic balance, that has income balance across countries of different income groups, that promotes coordination. So there are some criteria that the board itself exercises to select the final portfolio. So that's the way we work. On this question of the sort of country, was there a question around strategies to address pandemic preparedness and whether those have changed over time or not? What we're seeing through, so right now our second round is closing, it's going to close next Friday. So we'll be able to sort of compare what countries prioritized in their applications in the second round compared to what we received in the first round. But broadly, I think what we're seeing, we've engaged a lot with low and middle income countries in developing our strategic plan, which, by the way, we expect to launch at the World Health Assembly. And in those consultations, what we're hearing is that still it is these same areas as early warning, surveillance, laboratories, health workforce, a strong recognition that none of this can be done by one arm of government alone, that different ministries, different departments really need to talk to each other. And that part of the problem in the past has been silos. So integrated strategic, kind of approaches around national plans. There's also a sense that there may be kind of quite a few different national plans out there, a national action plan on this, another one on that, bring them together and, bring coherence. So those are kind of the main messages that we're hearing from countries. On the point that was raised around, COVID having led to, essential services suffering, that's precisely why I think, the international community came together on the heels of COVID and said, let's set up a dedicated financing mechanism for pandemic prevention, preparedness, and response. And the Pandemic Fund is it's the first of its kind dedicated financing mechanism that's focused specifically on making investments in prevention, preparedness, and response capacity in interpandemic years, so that when the crisis hits, then you're ready. Countries are ready, so they don't have to quickly divert funds from one to the other. So our goal is, to have a surveillance system that can, quickly be ramped up, to have labs that can, quickly ramp up their capacity to test, to have a health workforce that's there, which can be, kind of rapidly deployed in the face of a crisis, to have surge capacity that can be deployed, so that when the next crisis hits, you don't have a situation where you're taking away from essential, medical service delivery. So that, that is really the logic of being prepared with all that capacity that can be deployed. So I think those were kind of the main points I wanted to raise. And yes, I recognize, of course, there are competing demands, but I think there's, we're counting on the continued support of our major contributors, and we're counting on our ability to also expand our base. So I think I'll just stop there. Thank you.
Thank you, Priya. Maybe we go to Pablo to answer some of the questions. Pablo, do you want to talk about any of the questions, including, the role of G20 members? This year we have Brazil with the presidency of the G20, but also if you have any point about what to expect for the Financing for Development Summit. Over to you, Pablo.
Thank you very much, Javier. No, and I very good to all the points that were mentioned by Priya. I think the Pandemic Fund is doing a very important role in centralizing, and what was discussed before, we don't need more institutions. We need to strengthen and continue to work within this framework. Having said that, I think in the G20 there are very interesting discussions in terms of, I think the word today is innovative financing, right? And we hear this for many areas. For climate, it's how it has been developed much more, but now also for health. And in terms of health, given the structure of how these agreements are constructed, in many cases, it's like an ideal way to think about financing pandemic preparedness, right? Because you can get a flow of resources over a long period of time when you do some of these innovative financing arrangements. So that's a discussion that's been taking place in the G20. I think we've seen in this occasion, and it's something very positive, both the continuity from the work that was started in the previous presidencies of the G20. And not only, I mean, part of this comes from the Joint Health and Finance Task Force that really has the secretariat and provides this continuity, but also from the priorities that the Brazilian government has set in terms of pandemic preparedness being one of them, together with digital health that I want to stress that it's also a very important way to have surveillance, right? So it really contributes. Now, in terms of the development agenda, the development financing agenda, is where I really do see the competing challenges from climate change, from education. We see, for example, in Latin America, what the consequences of COVID was in terms of learning, and we need to invest to bring this up. But I think it's very important, Priya's point of saying, okay, we need a dedicated financing for this, and we need to be steadfast in that pandemic preparedness is something that we need to have a dedicated fund, a dedicated effort, and sustained accountability from all of us who are participating in terms of putting this agenda further. So this balance, right, between having many competing demands, now innovative financing has the depth to blank, and we have health, we have climate, we have education, we have many topics there, and that are all very important. But we are being too fast, I guess, in forgetting the impacts of the pandemic. And I've seen that in conversations with governments where I think it's kind of overwhelming and easy to say, okay, let me focus on something else, right? And of course, pandemic preparedness, investments in pandemic preparedness are most successful when you don't notice them, right? Because they are actually preventing. So it's very hard to continue to argue we need more resources. But I think this is a dilemma, and I think in the Latin American and Caribbean context, middle-income countries, most of them, this is a very, very important issue because we're not there yet in terms of putting this top center in the agenda. So I think this type of events and more evidence and arguing for this is important, and hopefully we will be able to have, I mean, as Priya mentioned, we have some projects now in implementation, and as we move forward and start to look at concrete examples of the regional work that is being done, and also the country progress in terms of labs, human resources, and surveillance, that will really catch the attention of the regional and government and national entities to move the agenda further. Thank you.
Thank you, Pablo. Fernando, do you want to answer some of the questions that were just asked?
Yeah, yes, certainly. Well, first of all, Priya made an excellent investment case. She already convinced me. But then when it comes to the details, the devil is in the details. You know? So let me start by asking another question. What should be the prioritization in terms of pandemic preparedness and response? And I want to link this to the question of what we'll try to Spain to promote in the upcoming Financing for Development conference in 2025, which I think it should be really a turning point in terms of coordination. We are very closely monitoring and following not only the discussions about the pandemic accord or agreement, but also the work and of the discussions of WHO and the G20, and we are very hopeful that precisely the Brazilian presidents will emphasize these matters. So what should we prioritize? Vaccination, maternal health. I think, and basically, we're talking about false trade-offs. I think that we need, as it has already been stressed, to build a global health system that serves the needs of all citizens, leaving no one behind. And I think we know that we're very well aware that the resources are scarce, that fiscal space is getting smaller and smaller. And I loved Pablo's indication. It is a little like climate change adaptation. I mean, climate change mitigation has a better sail in everything that has to do with preparedness. As you said, the best proof of success is really that no pandemic outbreak comes. But then the proof, the burden of the proof of attribution versus contribution and the political high-level sale of this is difficult. No, in any case, I think we will definitely stress, as Pablo just indicated, the importance of the pandemic fund as a specialized institution. I think we will also stress that it is, as one of the questions from the audience signaled, irresponsible to force fragile countries to earmark all their resources for PPR, for pandemic preparedness, without taking into consideration the toll of premature deaths caused by other chronic sickness or illnesses. So anyway, as a conclusion, we will try to contribute and help make the case for build a case for a global health system, and also I think that we will favor coordination, avoid fragmentation, and there will be very specific discussions about the financing mechanisms, but also I think it's crucial, for instance, to strengthen the information sharing on pathogens, and so as to avoid that this collaboration really benefits mostly only developed countries, given the through intellectual property. I think, for instance, the work of UNITAID, it's we praise a lot what they're contributing to really have a better access also in this regard. And basically, and I'll stop there, we urge a collective effort. As Guzman and Pablo stressed, we need that countries invest more in health. And as Needy insisted, that it should be lead to sustainable financial planning, no? And we believe, however, that this is a collective good, and that we need new partners to join us, and we will stress that as well. And now I think it's the moment to internalize the lessons learned from the recent pandemic. So we have high hopes regarding the conference next year, and we hope that we will be able to learn from the current discussions and promote more innovative coordination efforts. Thank you.
Thank you, Fernando. Niri, any comments on the questions?
Thank you. I'll make two comments. One on the reality of trade-offs, which I think is pre-articulated. The reason we want targeted investments in the PPR space is to mitigate trade-offs, but also there are some specialized capacities in health systems that are really specific to addressing infectious disease threats. But I think for us, our view really is to have a parallel accelerated effort of investing in comprehensive primary health care, as well as robust pandemic preparedness and response capacity. And that combination is really critical because it gets, I think, to this question around when you look at burdens of disease for countries, there is the baseline, and then there's what happens in an emergency, right? And that's different, but what you do see is that there is either diversion or redirection of resources, and also certain communities who are unable to access the types of services that they need. So if we look at a very broad view of preparedness in terms of resilience of health systems, it has to be centered around comprehensive primary health care and the specialized focus on PPR capacity. The second point that I'd make is we must have sustained and expansive investments in the health workforce. We have had countries in every continent experience issues of retention, migration, inadequate numbers, inadequate specialty areas. And part of that is looking at an expansive view of how we define health workforce to include veterinarians. This gets to the increasing threat that we have of AMR and of the zoonotic spillover, to look at real pathways for retention and for equal pay. And this cross cuts into other development areas as well. But part of the challenge that countries experience, no matter what economic level they have, but particularly those that are lower or lower middle income, is not having enough health workforce because of health workforce migration, right? Not having real pathways. I was just in Central Asia a few weeks ago and saw firsthand through a range of some of the investments USAID is making, a real vacuum of specialized areas, but particularly doctors, not nurses, because there was no opportunity in certain communities where doctors could actually get adequate pay for their level. So they have left certain, their countries or communities of origin. And that's a ripple effect across the globe. And so I think we do really have to look at workforce in a holistic manner, which is key for health system resilience at large. But when you have pandemic threats, particularly when the threat becomes reality and an emergency is unfolding, not having adequate health workforce will be the make or break, regardless of if you have the tools and if you have the financing commitment at large, because you need the people to actually do those response actions.
Thank you for that point, and thank you for that reminder. I guess importantly, global health has had a very beautiful golden era, but most of the money went to buy commodities, products, antiretrovirals, bed nets. So we don't have any way or any financing mechanism to strengthen the health care workforce. So something to also consider in terms of how do we, 75% of the amount invested in ODA in relation to health goes to the Global Health Initiative. So how do we also account for the the healthcare workforce and the human development? Question mark. Any additional question from the audience before I just ask my final question? Anyone else? Yes, please. Last question.
Thank you. I have a somewhat facetious question. So with public health, obviously you constantly run into the problem of, when things are calm, no one is interested in investing. But then when there's an emergency, it's all hands on deck. And then, amnesia sets in. And I'm just curious because, we often say that this is an excuse. This is the reason why it's so difficult to fund public health and global health priorities. Of course, the defense industry never seems to have that problem. And I know there are many reasons why that may be the case. But I'm just curious whether you feel there are any lessons to learn from, for example, the defense industry or other industries about how we could better approach the messaging around the importance of public health financing in calm times as well as during emergencies.
Anyone, please?
I think it's a great question, and I think it's an evergreen question where we're kind of continuously evaluating these conversations. I think one of the challenges that we've had as a global community is speaking in vacuums. So I think we are at a point where we have had, particularly coming out of COVID and lessons learned, many exchanges with health leadership of different countries, with finance leadership, with broader political leadership. But what we really need is cross-cutting high-level engagements that get more at the impacts of health threats and not just on understanding what a health threat is and what it is that we can do from a public health or clinical perspective in terms of mitigating those threats. And I think this gets to the overall impact that we've seen that COVID had, not just in resulting in a global decline in life expectancy for the first time in a century, or the decline in access to services in a range of areas of health, but also what we've seen in terms of the broader goal, the backsliding it had on broader development gains in the education sector, increased rates of gender-based violence, decreased economic opportunity. I mean, we have data now as the further we are from the kind of peak or the onset of the pandemic, that I think allow us to point to areas where we need to have much more multi-sectoral conversations around how investments and financing and public health are inherently tied to overall economic health of countries.
Thank you. Pablo, Fernando, anything from you?
I basically couldn't agree more with this intervention. For instance, we held this attached conference of WHO in Madrid, and for me, it was interesting to find also the obvious connection between the pandemic and climate change in both senses. The fact that has already been mentioned that climate change can indeed exacerbate or increase the likelihood of a new pandemic, but also that in a way it's responsible. The whole ecosystem or the whole system of health system is responsible for an important amount of emissions. I think at least this notion of linking these two efforts and funding sources for climate prevention and resilience towards climate change, I think that could be another way also to help this cross-cutting political dialogue and to favor more coordination.
Thank you. So we're getting to the close of our session. I just wanted to ask our panelists to give us the 1 minute takeaway. What do you want the audience to remember, or what is, the call to action, or what's the future of financing for pandemic preparedness and response gonna be like? So let's start with Pablo. Just short 1 minute remark. Over to you.
Thank you very much, Javier. Thank you again for the invitation, and I'm very glad to share with all the panelists. I think that the takeaway is we need to have this sustained financing and dedicated for this topic. We need to work with countries in Latin America and the Caribbean, at least, to develop these investment plans in order to have, as Javier mentioned, very specific investment cases for our governments in the region. Within the framework of the pandemic, of the overall investment phase that we have, we need to make very specific cases, and we need to continue this cross-cutting collaboration, because the One Health agenda that I mentioned before has been really revamped in the region. We see conversations taking place between ministers of the environment, health, agriculture that did not happen before, and that this large in part is due to how the pandemic fund is structured and requires that collaboration specifically to take place in the proposals, with only one proposal per country, for example, where really countries really need to think hard about how to build the best case. Thank you.
Thank you, Pablo. Fernando?
Well, difficult in 1 minute. I would say that the challenge of working together to reduce this perception of trade-offs between pandemic preparedness and global health, a sustainable global health system. I think that and also the takeaway that was mentioned by my US colleague, that where we work a lot is preparing an adequate and well-paid workforce. I think that the first line of defense is not only technology, it's really a workforce. And together with that, something that I don't think we have mentioned so far, which are the gender and cultural aspects of working with the communities and with community leaders to really pave the way and have a deeper sense of appropriation, particularly in low-income countries.
Thank you, Fernando. Nidhi?
Thank you. I would say preparedness is not a one-time action. There's been a lot of conversation around sustained financing, and I think the broader need is sustained action. We need to have common targets and common metrics to essentially measure our progress towards those targets. And financing is one, a major, but one of the tools that comes in behind around translating that vision into action. And so I think the key is to look at what's the big picture goal, and do we have a common way of measuring towards that, and mobilizing then how resources are used.
Priya, over to you.
So I agree with everything that's been said. I would just remind ourselves, and that's one of my takeaways as well. It's really not a question of if there'll be a pandemic, it's a question of when the next pandemic will hit us, when that battle will strike again. And really it is our collective responsibility to prepare the world now so that we can save costs and we can save lives. And that requires collective action. It requires collaboration, coordination, cooperation, communication, all the things we've heard through this morning, and requires sustained commitment from the international community. It requires political will and commitment from the global north and the global south. The dollars invested today, will really pay off. Every dollar invested in strengthening capacity in countries for pandemic prevention, preparedness, and response will pay off. The social and economic returns of these investments are enormous. So really, there's no time to waste, and the pandemic fund is here, so to support that effort.
Okay, well, if I may, summarize a bit what we heard today, I think we can end on a positive note. We've made some progress. We heard about the pandemic fund and how the pandemic fund has taken off and is here to stay, and it's actually coming to a next round of financing. Clearly, we see the US and the EU commitment to the pandemic fund and to new tools, new financing mechanisms. But clearly, we're far from where we have to be. It's not enough, not just in terms of money. We heard the figure 10.5 billion, but we also heard the 2 billion Priya told us about. So we still need more money. But it's not just more money coming from the same people. It seems that we need more champions, more countries, and we need domestic financing. Unfortunately, we also heard competing demands within health, beyond health, in a very difficult fiscal situation and macroeconomic outlook. But at the end of the day, it's all about political leadership, right? So if there is the political will to invest in pandemic preparedness and response in a dedicated manner, I think there might be a better future in terms of pandemic preparedness and response. I think I will end my call to action, if I just taking the luxury of being the moderator, is the measuring, because I think the measuring is not there. And I think we've been very successful at measuring numbers of lives saved, numbers of antiretrovirals administered, number of bed nets. And that's very appealing, not just to the funders, but to the public. But when you actually measure pandemic preparedness and response, it's very difficult. So I guess that's a challenge I will end the session with. So thank you very much for you for staying here. We now have our closing with Professor Jeffrey Sachs, who's joining us remotely. Welcome, Professor Sachs. Thank you very much for being with us.
I'm honored. Thank you. Thank you very much. I was listening in just to the current session, so I missed a lot of the deliberations. But let me make a few points. First one that is, I know, is very touchy, but I want to make it because we're in a room of health leaders. We don't know yet where this pandemic came from, but I've studied this now for 3 very, very intensive years, and I think the evidence is now quite overwhelming that it came out of US laboratory research. And that is part of preparedness. We had a tremendous amount of gain-of-function research hidden from view, extremely dangerous, pushed by the NIH, funded for also collaboration with China. And all of it has been suppressed since the outbreak. So everything that we know has come through leaks, whistleblowers, Freedom of Information Act releases, the discovery of the Diffuse project, which would not have been known except for a brave whistleblower inside the Defense Department, and lots of continuing lying until today, which I know about from what I've seen. So in terms of real pandemic preparedness, the world bio warfare and biodefense industry continues, and it's extremely dangerous. And my own view, just for whatever it's worth, is that we're probably 98% in this case on the lab leak side, and only 2% on Nature. I think that furin cleavage site was specified on page 10 of the Diffuse project. And I think they carried it out. And there's lots of evidence that they carried out the Diffuse project at Rocky Mountain Labs, at NIH, at UNC, at WIV. And that's about pandemic preparedness. But we don't have honesty or transparency because this is deeply hidden inside the bowels of our defense and intelligence community. So I just want to make that point because I think as grown-ups, we owe it to ourselves to have a true discussion about these issues. And it's very, very hard in this world to have such a true discussion. Second point, I really think in general that by the focus on pandemic preparedness, other than the way that I just discussed, we miss the broader point that we have crises of health systems that are so glaring and so obvious and need attending to and need financing that it's too easy to say, well, this is about pandemic preparedness. This is about primary health delivery. Once the virus hit, wherever it came from, whichever lab it originated from, or however else the first spillover occurred, everything depended on a primary health system after that. So we should take that seriously. And I helped to design the Global Fund 24 years ago. It came into existence because Kofi Annan championed it, because George Bush Jr. supported it at the time. Bill Gates supported it. And we actually established a mechanism for AIDS, TB, and malaria. And it has saved, tens of millions of lives. But one of the lessons from that is that it all depends on a primary health system, just like a pandemic response depends on a primary health system. All of that depends on community health workers, on information tracking, on information management. And for 20 years, I've tried to get health worker financing systematically into the Global Fund or into Gavi. And it's still not there. It's there indirectly if it relates specifically to AIDS, TB, and malaria. But if it relates to the basic primary health system, it's not there. So why don't we make really a global health fund, not a pandemic fund, not a global fund for AIDS, TB, and malaria, not a global fund for vaccines and immunizations, but a global health fund that funds a primary health system, and thereby the capacity to deliver vaccines or meds or bed nets or antiretrovirals or the other things that are part of a primary health system. I think Gavi and the Global Health Fund and the Pandemic Fund should be merged into a Global Health Fund in Geneva, and it should be properly financed. And its real goal should be target 3.8 of the SDGs, which is universal health coverage. This means that there's a trained workforce available in every low income and lower middle income setting. We can assume the upper middle income and high income countries can take care of themselves. And that we really save millions and millions of lives, even in years when there isn't a pandemic, because it's plainly obvious that funding a primary health system as needed to achieve universal coverage would be the most phenomenal return on health achievable on this planet. And adding a separate vertical fund for pandemic response to God knows how the next pandemic will come doesn't face the real issue that we need primary health systems. The final point I want to make is that the world is rich. The budgets are poor because we don't tax rich people. So the wealth is over the top, unbelievable, limitless, a couple thousand people with $14 trillion of wealth. And we cry that we don't have enough to do anything. So we need actually, at this point, not pledges by governments. We need a basic system of global taxation to fund these global goods. I think, as was discussed at the end of the last session, the link to climate is real. Let's put on even a modest levy of $5 a ton on CO2 emissions by the high-income countries, and you get $100 billion a year. Put on travel taxes, shipping taxes, financial transactions taxes on international transactions. You get hundreds of billions of dollars per year. Remember, the world economy is $100 trillion, so even raising $500 billion a year for health and education and other urgent needs would be 0.5% of world income. So I think that I spent 40 years trying to get money out of my government, out of the US. Once in a while it worked. It worked with the Global Fund, with PEPFAR, with the Malaria Initiative. Nothing has come out of the US other than military spending since basically the first decade of this century. We need more systematic finance. We need some basic global taxes to finance some global public goods. If we put taxes on global bads like CO2 emissions, we do double duty with those taxes. So my recommendations, just to summarize, are first, let's understand where this virus came from. Stop hiding. Let's find out the facts. Maybe it was a natural spillover. I don't think so, but let's find the truth. Second, let's have truly funding for a primary health system rather than vertical funds. And since I'm author of one of those vertical funds, I want it to merge into a basic health system fund. And third, let's introduce global taxes on things that are not currently taxed or taxed properly, like CO2 emissions or international shipping or international travel or global financial transactions, so that we can actually raise the scale of revenues that we need to achieve what we have set out to achieve, which is the Sustainable Development Goals and a safe climate. So just a few very quick thoughts, and again, many thanks for the opportunity to join your very important deliberations.
Thank you so much, Professor Sachs, for all your remarks. We really like to listen to different approaches, and the debate is so live, so it's a critical moment. Thank you so much. So now for closing, we have our Vice Minister, Javier Padilla. Yes, closing. It has been a long morning. Thank you so much, all the audience, from the academia, from the different embassies, international organization, US government. Thank you so much for being here. So now is the end.
Thank you very much, Eva. Thank you especially to Spanish Embassy, to IS Global and the Center for Global Development. I think it's been a pleasure, the opportunity of being speaking here about these topics. I'm going to finish very briefly. I just wanted to end with a sentence of Italo Calvino that he says, "Seek and learn to recognize who and what in the midst of hell are not hell, then make them endure and give them space." I think if we look at the pandemics, we should identify what things were not hell. And I think that some things about the initial steps of tech transfer, the common concern of developing capacities in every region, the improvement of development of health information systems, the conscious of the need of global cooperation as a condition of possibility for global safety and global health, and the need that these actions move towards a general improvement of universal health coverage, universal health access, and health systems. These things were not held, and we need to know how to give them a space. I think that we can say that the best pandemic preparedness is improving health systems, and the best pandemic response is primary healthcare. So knowing that, I know and I think that we have a very good path towards our way, and it's been a pleasure to be here today with you. Thank you very much.